podium? Or?
If you want the podium, we can sign out.
So my name is Sarah Wagenbug. I'm the Director of Substance Use Disorder Programming and Same Day Access with Versus Health. Our presentation, our application really hinges on some key roles that are linking services. We do have the fourth judicial contract for like problem solving court, drug courts that we are working with, but we provide same day access intakes so clients can walk directly into any of our centers and get an intake same day. And then within 3 days, they are scheduled into services. Sometimes it does push out depending on their timing. We have had clients that have pushed out, 10 to 14 days if they have specific needs or specific locations that they want to go to. The positions that we're really hinging on with this would be our SUD Resource and Referral Navigator. It's a brand new position that we just started in October. And her role is to link all of these services. So she works closely with probation. She works closely with any outside referral sources. Some of the school districts, we have a contract with D2 right now where we're providing services in the schools. And she makes sure that those clients coming out of CJC, out of Department of Corrections through the InReach program, and then any type of court system know where they're going, links back to their probation officer, connects with them if they're not showing for services, kind of keeps them in a loop. And then also connects them to external services. She has been really successful in keeping clients engaged. It's an extra point of contact, but it also isn't a therapeutic role. So she isn't the one, as clients have told me, getting them in trouble for not coming to services. She actually works with the client to figure out what's going on. Why can't you make it in? What's happening? The other roles that we are really kind of looking at for this is our peer recovery services for our SUD program for teens and adults. We want to support that model of recovery for our clients, and then also our transport driver. We currently have a transport driver who gets clients to and from groups, which has been huge help. Bus services we know sometimes aren't great in Colorado Springs, and then also Medicaid rides stop running earlier in the evening, and we have clients that are in group until 8 o'clock and then don't have way to get home. So those are the three kind of positions we're really looking at.
So with that, we'll open it up for questions. And
Was there a second page of this that shows the financial breakdown of the request?
no, they just gave us one slide.
There's this, okay.
Sorry, it just on the slide, it doesn't say
Next time. Sometimes they do. I didn't know if we had one. I got a couple. So currently, what is your current intake rate or pathway? You set some goals here, of same day intake within 3 days, seven days of intake assessment, etc. Is this what you're doing currently, or is this something different?
This is what we're doing currently. We want to also move this more centralized to our SUD program to have our SUD clinicians handling more of our SUD clients. Right now, all of our clients come into the same walk-in center. So our goal would be to, with the help of Molly, who's our resource and referral navigator, get them more centralized with our SUD team specific.
Okay, thank you.
No questions. So line
Wait.
for 342,664. Yes, question.
Right here. Just curious, because you cover the whole region of 16. What's this program look like in Teller County?
So a lot of it is virtual right now. I don't have the clinician capacity. We do have a mental health clinician that are in some of our bigger regions or our smaller regions, sorry. So they can go into the office and up there, they can do a virtual intake and we can do virtual services. We don't have any in-person groups right now for SUD, but we do offer as needed and when it's appropriate in-person or virtual groups, sorry.
So if they came down to El Paso County, they would be served just like this?
Yep. Yeah. But we try to eliminate the barriers. I just don't have the staff right now or staff that lives in the area that is credentials for SUD. But if they do come down, they can go to any location, and then our main substance place is Jet Wing for our treatment. But we do offer telehealth if a client just can't make it.
How much is the salary for the one person?
For which one?
There's several different people in here.
Yeah. So we have our resource and referral navigator.
Mhm.
We have 2 peer specialists, and then we have our transport driver. and I greatly apologize, I don't have that off the top of my head, I put it in my proposal, I broke it down.
Sure.
I just didn't, when I read the email, it just said the one sheet, so I didn't put it on there until.
Yeah, and this covers all of those.
That covers all of those,
salaries.
yeah.
And they're currently employed right now?
The resource and referral navigator and the transport driver are currently employed.
Okay.
We are looking to employ, we had some of our peer services leave or peer specialists leave, and so we're trying to refill those.
And what do you feel that your success rate is then?
I pulled the numbers, so our success rate, we have a hard time measuring that with substance, right? Because we don't always know what success looks like for everyone. I would say right now in our program, we've been about a 37 to 43% success rate per client self. So we have clients that we call after treatment that don't answer us, so it's hard to get those numbers. But that graduate successfully from our program and leave. UAs are clean, sobriety, for self.
Have you attempted to find other funding streams such as billing Medicaid your services?
Yep, we currently bill Medicaid. We are contracted with Signal, so we get some Signal funding for indigent clients. And we have applied for a few other funding streams, just haven't heard anything currently. We are doing in-reach assessments with CDOC. So they are paying us the Medicaid rate to do assessments while clients are in prison 30 days prior to their release. And then once they get out, we're helping them get Medicaid and get services. I would say 90% of our MySed services are Medicaid.
Yeah, just a little bit about the transportation. Can you just speak to a little more? How does that work? Do you guys own a vehicle? Do you just have a list of people that you're picking up and driving? Just how does that?
Yeah, so we have a 14 passenger van. We also have I think a 7 passenger van. We have 2 vans that we utilize for our program. Our transport driver goes to all of our groups and talks to a lot of our new intake clients. Our resource and referral navigator also sets them up for transportation. We have about a 12-mile radius from our Jetwing location that he will pick up if clients can get to a drop-off point. So we have clients that live out in Peyton that will get at least into that 12-mile radius and then be dropped off and picked up. So he goes and gets them prior to group, and then after group, he takes them to our biggest get, I guess, for our clients is our evening groups, because our last group runs until 8 o'clock and a lot of transportation. The bus outside stops at 7:24.
So what is the breakdown if you were to add the salary benefits, if there are any for that employee, the 14 passenger van, gas, insurance, you know, all of those things combined? Do you know what the per trip rate is for those who are picked up and dropped off?
We did that pre-COVID. This is a newer position. We didn't have anything for a long time. I haven't run the numbers recently because it's more of the reason we haven't is it's more of like our clients need it or they're not going to come. We have figured he's been transporting between 47 to 52 clients per month to group services, but I don't have the exact breakdown.
You said, Kenny, you maybe did, or do you have a ballpark of what it was before COVID even?
I'm not sure. I was not in this role before COVID. I know the previous director did. I'm sorry. But if that's information you need, I can try to dig it up and get it over to you guys.
I just think it's valuable anytime that you're looking at that kind of a transportation, to your point about buses, but it's interesting to me to know the cost of breakdown because there are other types of services that, you know, are out there on the free market. And so just kind of curious how that compares to the other types of services here.
Our biggest issue with a lot of our clients, because we do need to have those evening services, we have a lot of clients that do work, is that Medicaid transport. I think there's one company that runs past 7 p.m. hasn't been proven to be super reliable for our clients. And then once they're there and they're stuck, there's no way. I had to call Uber for a client a couple of weeks ago because our transport driver isn't there. So we kind of are hoping that helps them come back.
But kind of to my point, without understanding what the cost per, you know, having a staff member maintaining all of those things, is Uber a cheaper option? I mean, that's why I'm asking kind of what other options are out there? Is this the most economical way of getting people back and forth to use my binder? But then I'd love to see that information on breakdown trips.
Any additional questions?
So you've got 7 or 8 goals listed on here, or outcomes listed on here. Which, if any of these would continue should you not receive funding, or Or you look at it the other way, what wouldn't happen on this list, if you didn't receive the funding request?
I think looking at it from what wouldn't is probably easier because most of this we are committed to trying to continue in some way, shape or form. I think increased peer support services is gonna be a hard one. My budget for this fiscal year does not include peers. And so that is hopefully something we can provide through grant funding. The rest of it, I mean, is stuff that we are currently striving towards or already doing and hopefully will continue.
Thank you.
Any final questions?
Oh, we got one more. I'm sorry.
Alright, part of me kind of struggles a little bit because, yeah, you guys have been around like. You guys really are the low barrier thing, but this sounds like you're setting up something new per se, but you're really not, you're expanding what you currently already do, right? So it sounds like it's that you've got like a lot of agencies like yours, you've got issues with getting funding that you normally had avenues to, and now you need another source. And I'm trying to read between the lines here.
Oh, no, that's very true, because we lost a lot of federal funding, with all the recent changes. We had to let go of some positions due to that. And so we are trying to continue doing the services that we've been doing and also increase them because we know that there is a huge need, for opioid.
Which is also, I mean, you're one of the few low barrier, like no cost components. But there's challenges with that. I've talked to people where there's like upwards of 80% of people don't show up for appointments and stuff like that, which really makes it difficult to operate when you can't get your clients to actually appear. And I hear the transportation piece, but even there, it's a struggle because sometimes they don't. Oh, so, all right, that helps me. I just, again, I was like, it sounds like a new program thing, but you guys have been around a long time, but I think it's more of, you've lost a lot of funding. Now you're trying to make up some of that funding to just keep sustaining what you do, which you've done a lot of good work over the years because you've been one of the only providers.
Yeah, and that's what our resource and referral navigator, that is what her role really also is created for, is to engage those clients. And we know this industry, we have a hard time engaging people, they have to be ready. But to kind of keep on them and find out what those barriers are, like what is it? And hopefully help them to engage.
Any final questions? Okay, thank you for your time. Next, we are going to hear from the light continues, and this is St. Clyde or Raiders. Some more than 39,000 already.
See you all. We're on the Safe Side Recovery. Hopefully you all have had a chance to review our proposal a little bit, and we have our slide up here. So in my brief time, what I'm going to do is tell a story of a current client of ours at Safe Side. And it's a story that really matches up with the continuum of care that our proposal has. About a year ago, a young man named Jeffrey came into the Pueblo outreach shelter. He was actively using drugs and looking for a place to sleep. The outreach shelter, very similar to the Springs Rescue Mission Relief Shelter, is low barrier. Down there, it's open 9 p.m. to 7 a.m. It exists for people who are actively living on the street and aren't ready to commit to a full program of recovery. It really exists to remind those people that somebody cares about them and that they matter. That night, one of the shelter staff, Pat, took a few minutes to talk with Jeffrey, and Pat encouraged him to check out our recovery residency program that we operate at the shelter. Jeffrey submitted an application, and two of our staff, Dave and Ryan, at the residency program, met with him, did an intake interview and explained what was involved in the program. And Jeffrey said he was ready to make a change in his life. I ended up meeting with him about a week later. Carol, another coach, and I were filling in for a group, doing a support group. And to start the group, I asked the folks in there, rate your hope on a scale of 1 to 10. And Jeffrey, through tears, said, "I'm a one." And then he shared that 2 years earlier, he had lost his wife and newborn child during childbirth, and the grief wrecked him. And he spiraled into drug abuse. He was a broken man. That afternoon, we hugged him and cried with him. So Jeffrey was assigned to one of our recovery coaches, Big Mike. Mike had once been a college basketball player before alcoholism in prison took over. And now he's one of our best coaches. Together, they made progress. Jeffrey got sober from his drug use. He found a job at a nice restaurant and enrolled in Pueblo Community College, even earned a scholarship and took a peer recovery course, his initial course with us. So like many in recovery, Jeffrey had a blind spot. He admitted being a drug addict, but he was not an alcoholic. When Mike transitioned to a new role, Jeffrey's next coach, Tess, tried to get him to see that his drinking was an issue. He was in denial about it, like often happens, until he got kicked out of one sober living home and then another, both due to drinking. At that point, we knew, and Jeffrey knew, he needed something more structured. So Tess recommended that he enter Safe Side Intensive Peer Program, which is called IP2, and move into one of our sober living homes in Denver. At this house, in addition to IP2, he received clinical support and a 90-day IOP program with one of our partners. And the team of peer coaches there, Evan, Heather, and Franco, got him situated at the Zenith House, and through a lot of hard work, something clicked. Today, Jeffrey is thriving. He's 6 months sober from alcohol and 12 months sober from drugs, serves as a house lead, helping others like himself. He even has a video that you can see of his testimony on our website. But Jeffrey's followed the continuum that we're presenting to you all. First, outreach and engagement, assessment and screening, stabilization, recovery housing, community reentry, structured recovery. And it took a team to do that. I said their names: Pat, Dave, Ryan, Carol, Mike, Tess, Evan, Heather, Franco, and me, and our clinician Taylor, and many others on our team impacted them. But more than that, it took a system that led by certified peer coaches and clinical support. And that's the system that we've suggested for the Region 16 plan. And with your support, we believe that we can make a big impact in Region 16 and help a lot more Jeffreys that are out there.
Thank you.
Thanks.
And with that, I'm gonna open it up for questions.
Is there any other slide besides this one? Or?
This is the only slide.
Okay.
Yeah, we're touring like her.
Yep,
Only
that's
did
fine.
one slide.
I'm with that.
Yeah. Well, that's a hard question.
Yeah, I'll jump in. No, I'll go ahead and jump in. So for your IP2 program, for that transitional housing, do you have any of those here in Colorado Springs? You mentioned sending somebody from Pueblo to Denver.
That's what we're proposing for you.
That's what you're proposing is to open one
We
here
have 4 homes, 2
and
men and 2 women.
that you would serve 53 within this area is projected goal. Is that correct?
Mhm. Yeah, by year end. Okay, we're currently doing a lot of outreach work already at this Springs Rescue Mission. We do several groups and one-on-one things there a week, and they're interested in us supporting more with what's going on there with them having got staff.
Have you identified those homes? I mean, are you
We have
buying
not.
them?
We've talked with real estate agents and we have some leads on some things, but we're really waiting for this to happen. If we do this on our own funding, it will happen much more slowly. We will do 1 home in the next 6 months and build on that.
You're buying them or you're renting them? Okay, so you're renting them. And using vouchers, using justice money to pay for that.
For our intensive peer program, as long as they're engaging in peer support, it's no charge to them, because when we ask them to come into the home, they participate in 12 weeks of the intensive outpatient. And then they do peer groups in the evening. So for those 12 weeks, we ask them not to work. So we fund it through Safe Side.
And how many people per home?
So we have 2 homes in Denver. Right now, we have, between both homes, we can house 18.
Thank you.
Additional questions? Hearing none, thank you for your time.
Thank you.
Okay.
Next up, we have NME recovery residents. We're asking for $167,000.
Hi, everyone. My name is Chelsea Baker. I'm the owner and program coordinator of Enemy Recovery Residents. This is my brother, Steve Smitty. I call him our subject matter expert. I have never had issues with addiction, but he has. He's one of my three brothers. All three of them are addicts. Stevie has, he's coming up on 4 years sober right now, and he's been an addict for. So he's been an addict for about 35 years, most of his life. We opened up our house, a sober living home for women, on March 1st of 2025. We've been talking about this for probably 15 years, just because it was something that I was kind of passionate about in the beginning, and then having walked beside all of my brothers when they were going through their addiction, ups and downs, ups and downs. But he had more downs at the time than ups, so we were never really able to do it, because I knew I could do it by myself. So anyway, fast forward, March 1st, we open our first house. In the Security Whiteville area, the southern rear of Colorado Springs. When I first did our application, since it was towards the beginning of this year, end of last year, it was for us to be able to open our first house and kind of manage costs and stuff for that first year. We ended up opening the house without that. I say it was kind of independently funded. We basically just took our own money and built the house. It's the house that it is I lived there for 15 years, raised my kids there, and we just wanted to do something great with it. So the first 60 days are the most fragile, and our data shows that the most relapses occur. So when we first opened our house, we kind of put together 4 different strategies of what our plan was to be able to help this problem that is like just getting worse and worse every day. Our 4 strategies are evidence-based support for recovery, collaboration with local providers, access and affordability, and then policy engagement. So I just want to real quickly kind of touch on each of those and how we think that we would be able to help with the opioid epidemic in our community. The evidence-based recovery support at our house, before people come into our house, I have a conversation with them. We're not like a lot of the sober living houses in the community. We require our team group sessions that they do twice a week. We require that they attend recovery meetings at least once a week. We have our curfews. We have, everybody has chores and daily routines. We have mandatory life skills meetings. We support math therapy and outpatient therapy as well. But what we're most proud of, at least what I'm most proud of that we do, is we've partnered with some employers locally who have dealt with addiction themselves, and they're now business owners or high up in companies, and they've agreed to kind of partner with us to put the women that come into our house to work within 48 hours of them coming to the house. So right now we have 8 women in our house. We're approved for up to 15. I think we'll only go up to 12, but everybody in our house works. And some of them, we just had 2 people that came today that are scheduled to work tomorrow, Friday. And that's just been it's a game changer. It's fun to watch them when they come in. Some of these women haven't worked for 15 years, and they come in and they just automatically have that sense of like purpose and being able to support themselves when they didn't have that before. Okay, so our second strategy, collaboration with local providers. We knew coming into this, we couldn't do it by ourselves. We work really closely with some of the outside recovery agencies, trauma and addictions counselors, mental health clinicians, course recovery coaches, math therapy providers, as well as different inpatient treatment centers. If our clients are justice involved, we work very closely with the probation and parole officers, and even often attending court appointments, court appearances, we call them, with clients to kind of speak on their behalf. On our list of things to do is to form relationships with the emergency response services to include the opioid response team with CHFD, CFPD's homeless outreach team, and local EMS agencies. So when someone does survive an overdose, we can be part of the follow-up care plan for those folks. The third strategy, access and affordability. Everybody knows, like, usually this demographic, the people that are wanting to come into our house don't typically have money just hanging around. You know, every now and then we get people whose families are helping them pay and stuff. With the funding kind of drying out well before the end of the fiscal year, that's been an issue. And we've been trying to offer scholarships on a sliding scale based on level of support and progress. So we meet with them and, you know, keep pushing them and set goals and try to figure out where they're at in their recovery. And being able to help them cover the first month or two has been a game changer. The last one is our policy engagement. My biggest goal is to help affect policy change in our area. Over the past couple of years, when I was looking to kind of go into this area, I went to a bunch of sober living houses, met with lots of people. I literally just put a thing out on Facebook saying, give me some names of the people in the industry that I can talk with and kind of get an idea of what we're looking at here. And over and over and over, you see people leaving sober living homes because people are doing drugs in the sober homes. People are coming back drunk, and we're not holding them accountable all the time. So my brother actually had an experience like that when he first went into recovery. He called me after working 16 hours one day and was like, there's two guys in the garage. And I'm a super big goofball, you know, and that just didn't make sense to me in my mind. But when I started asking questions, it's certainly more common than I thought. So what we're trying to do is have people, we're trying to lead by example and staying engaged. One of us is at our house every day. I'm monitoring the inner workings of what's going on at the house. I talk with the women. Yeah, we have our camera system, which everybody has, you know. I talk to most of these women every day. Sometimes it's just like a high five because court went great yesterday. Sometimes it's, hey, I need a recipe for chili. So it just kind of depends.
So, question.
Yeah. Yep.
That, let's open it up to questions. Please.
I guess I'll just jump in. So talk to me a little bit about your organizational structure. Are you an LLC? Are you a 501c3? Talk to me about that part of your.
So the house is an LLC, and that's kind of just when I first started this whole thing. That was basically the quickest and easiest way to get us right. Once I did the LLC, I started the process of doing a nonprofit because I wanted to have a way to be able to help other sober living homes. Everybody's not going to be a good match for our house because we are more strict, I think, than a lot of places. But we did the nonprofit as well to be able to offer scholarship opportunities for people that don't fit in our home. Maybe they fit better at a different, in a different area or a different agency that does things a little bit differently. So I think that one of the biggest things for sober living is that people can't afford it. And we know every year the funding just vanishes. And so then people can't afford it. So we did the nonprofit as well to help fund other sober living scholarship programs.
Okay, so the nonprofit is that's been all the paperwork's done on that, and you've got the nonprofit. Okay,
Yes, sir.
And then how long on average do you anticipate? I realize you just opened in March, but how long do you anticipate on for individuals to be enrolled and be residents of your program?
The things that I realize are wrong. Sober living, and I haven't been there in a couple, 3-4 years. But I kind of put together a 1-year program, and it's not about just being sober. It's about going into the house, getting employment, getting a routine, getting a bank account, starting to fix your credit. There's so many parts of this that people don't really focus on. Like being sober's, the beginning of it. But it's a really small part, and then you've got to add and add and add and get used to these things as you go. So we, like, our girls that come to the house, we kind of tell them, look, we don't want you coming in here and then just bouncing out as soon as you get a couple paychecks, because you're not ready yet. I tell them that I think a year doing this program in the house, and it'll be the same. We just found out that we closed on the men's house, so we will have a men's house open also. But I think within a year, that's what worked for me.
The whole idea is, you know, we start the year, we don't want people to leave when they think they've got it down, you know, all the data, no matter where you look, shows at least 6 months in sober living leads to the best outcomes. So, we want people to commit to at least 6 months and then go from there. You know, what the biggest thing is letting us know what resources they need and what barriers they're coming up against, because we can help.
And they also see results along. So seeing those results with every little thing coming in, you build on those results and you focus and keep pushing, keep pushing, keep pushing. So ultimately, I would love to see them come and go within a year and be in their own place and be back on their feet and still sober and everything else. But it's a multifaceted thing. To concentrate on just one part of it, it's not work.
You said that you provide scholarships. What does it cost the individual to be in the house per month?
$700 is our monthly.
Okay, and are those individuals receiving vouchers and housing assistance from Fountain Valley Housing or anything?
Now, we don't have, none of the girls in our house right now are not getting any money. So we've, the first couple months, for most of the girls that are there now, we helped them with the first 90 to 100, no, 60 days. And that's really been great because they were able to start working right away, get some money saved up, and then now they're able to pay their own way. They're not waiting on money for anybody
You
else.
said it was 15 girls is how many you have?
That's how
That's
many
the max.
The
we
max.
were car certified for. I
But
I
700.
don't see us having 15.
I don't think we'll go over 12.
Yeah, we have 8 right now, but we just opened March 1st and we already have 8. We will probably be full in the next 10 days.
The reason that we were able to do the scholarships is we were able to get a small donation. And we've made that really stretch way further than we even thought. So, and we're still stretching it actually. But what we're trying to go for here is trying to get help with just that initial. So they have money to get them through until they start getting their own money. And we do that automatically too, working with the employers that we work with straight through the houses.
So you're obviously new at this, so you don't have a lot of long-term data or anything to kind of share with us, but could you share what does success look like to you in terms of how many people, you know, out of those 12, if they're going to be there in a year, how many do you expect to come out of the program successfully and be out on their own in a sustainable way where they are independent? And then do you have any plans for how you would kind of track that information that we would be able to get back in the long term, whether that's 3 years down the road or 5 years down the road, trying to check in with people? What metrics would you put in place to help us understand what the true impact is to people in the community?
Yeah, so my real life job, I've worked for AMR Ambulance for 26 years. And at this point, I'm a data analyst for our nationwide communications center. So I live and breathe spreadsheets and data. So that was like the first thing when I started doing research, talking to all these different places, like asking them what are their expectations and how do you measure if you're successful? Because the whole thing is being specific with what you have and having some sort of, I just had this conversation with him a couple days ago. You have to have something that's measurable. So we're looking at how many of these women are able to go to work within the first 30 days. How many of them are able to sustain sobriety for 90 days? The whole idea of relapse is real. And I have just had to kind of learn that it's part of this whole process. So we're trying to see, can they get through that first 90 days? We have an app that we basically run our whole business on, one-step software. So it gives us data and reporting throughout. And when I discharge someone, I can put on there, was this a positive discharge or a negative discharge, you know, and it'll let me select, where are they going to from here? If my answer is, I don't know, that's a negative discharge. If they're going to another sober living home, is it, you know, what are the reasons behind that? So I have the capability to get a lot of data because we started off right away using this application that makes it really easy to track it.
And we have two examples right there. They both came into the house 4 or 5 months ago with no job. And one's a GM on McDonald's and the other is a manager of 7-Eleven. They both started from the bottom. It's been 2 or 3 months.
So first of all, I just want to commend you on your guardrails and the approach you're taking, holding people accountable. I think that's really refreshing, and I think people appreciate that. Individuals in that situation don't know any different. So I think, you know, having guardrails keeps them honed in and accountable. So I do just want to commend you on that, and the job is very, very important, and self-sustainment and giving them a year. I think that's very, very important. The question that I have for you is this budget built around 15 because you have 8 and you say that you're hoping to get 12 and 12 is your capacity, but on this it's 15.
Yeah, I would say that the way that I tell everybody is we won't really go above 12 unless there's some sort of a situation that requires it. I would rather not, I mean, living in a house with 14 other women, I feel like it's a lot. So we are car certified for 15 at the house because of square footage and stuff. So those numbers are based off of 15. If we were at full capacity, if I have all the supplies, I have the beds and everything ready to go. Say we have, you know, 2 people that, or 3 people that get released from Spring Grove today, and they all want to stay together, you know, okay, it's not ideal, but I can take them, I can provide a spot right now. So because one of the hardest parts, and I'm learning this as I go too, sometimes when people say that they're ready and it's a yes today, if you don't get on it right now, it is a no tomorrow. And they may disappear and you'll never see them again. So, and that is true. But
We think it's important to stay engaged. We have cameras all the way throughout the house. Every once in a while, we'll pop on them. We see somebody just kind of nodding off or something like
yeah, I
that.
tell
You know what I
them
mean?
all the time,
We stay severely engaged. Watch, pay attention. One of us or the other of us is there every day. I live right up the street and I'm maintenance and outreach. So I pay attention so I don't have to fix them. So
That's a good reason.
I just have one last one. So the first 6 days is important. You've been able to initially provide some scholarships. How important is it for your residents to, at some point, take over the financial responsibility themselves to your program?
they do both.
I think it's huge, especially being a woman and in this kind of, you know, dealing with this kind of issue. Being able to, I mean, I could give examples of when they come up to me with their envelope, of their rent. And it's like they're skipping away, you know, like I just did that all by myself, you know. So I think it's huge. A big confidence builder. So that's why I think, like, because most of them cannot afford it. And we just we opened at a time where all the funding was all messed up. Diverse is changing to Signal and all of that. So nobody was able to get funding. And so we kind of had to figure out a way to make it work.
And we did. And as soon as, like, the funding that we're wanting is just to cover them till they get their first couple of paychecks. And then everything becomes self-sustaining. We're not billing Medicaid. We're not federally funded. Everything that we've designed this program to be is self-sustaining. They pay their rent. They pay for their stay. We don't handle trauma, we don't handle addiction counseling, we don't do those in-house. They go and do those separate. We do in-house groups twice a week to keep them in line and on track. So, and it's working.
One quick question here, are you guys familiar with the either Step Denver or Step Springs programs by any chance?
No.
It's actually sound very similar in a lot of ways to very successful programming. And I don't even know how long, 25 years of existence, and data. And so just as a side note, regardless of how this goes, they are opening a facility here. Just might be someone that would be helpful for you guys.
That's been the biggest help around is being able to talk to other people who've done it and have been successful or unsuccessful.
And those are men, right? And you're
So
with.
they only do men, but anyway, it might be a good connection
Yeah,
for
for
you guys, because it sounds very similar to ours.
Thank you for that. Okay.
It's coming down the pipe. Oh, sorry.
So we talk about it.
That was fast and sure. I was a lot of it. One request is 799,470.
Yes. How is it? Excellent. Are we good to start? All right, thank you. So I'm James McLaughlin. I'm the Director of Community Paramedicine at Pikes Regional Health Service District. All my friends call me Tiny. My goal is to have everyone in this room call me Tiny by the end. Fair enough? And I'd like to introduce you to one of the most important members of our team. Darlene?
I'm Darlene Baker, and I don't know about that, but I'm a psych nurse practitioner that has started to integrate this last year. Haven't been quite a year yet. Switched with this paramedic team with MAP response, mobile response.
So Pikes Regional Health Service District, we are the mobile crisis provider for Teller County. That means when somebody calls 988, it's our team that responds when a mobile crisis team needs to be deployed. We believe in a no wrong door approach. You can access our services anytime, 24 hours a day, 365 days a year. We have community paramedics that are trained in behavioral health response to respond out to your crisis, de-escalate the crisis, medically screen you on site, and then alternatively destinate you or hopefully get you set up with resources at home and in the community, because we know that's when people do best. I'm not here to talk about that program today. What I'm here to talk about is our need to connect with all of our community partners. When I walked in the room today, I was crazy excited because everyone I see in this room, almost everyone in this room, I know. It was like old homecoming for me. And reaching out and hugging people, because I tell folks all the time, generally speaking, Pikes Regional Health Service District is not the answer to what you're going through. We come in, we scaffold you, we support you, we empower you to find solutions to your own crisis, and then we refer you out to our partners who are the experts in all the individual areas. If you need food, we have a partner. We'll give you enough food to get you through a couple of days, but then we're going to connect you with a food pantry. If you need wraparound services for your family, we're going to set you up with community partnerships. If you need sober living services, we're going to reach out to our partner, Serenity Recovery. If you need medication-assisted treatment, we're going to reach out to another partner. Connectivity and collaboration is what our program is built on. If you were to open it up, it wouldn't be Duracell inside, it would be collaboration. That is what we are all about. What we were asking for is funding specifically for tools that allow for that collaboration. So we're looking for, and anybody who's worked in El Paso County has probably heard of this before, Gelada. Gelada is a referral tool that allows us to go out and make referrals to partners. So the idea is we show up on scene and we do a social determinants of health screening now. And then we have to manually go out and find the community partners to tie people with. With this tool, we'll actually be able to
do that social determinants of health screening, and it will make recommendations, and then we can do hard handoffs through that tool with all of our community partners, with DHS, with Teller County Public Health, with Serenity Recovery, with Porch Light, all of those partners. Hey, I got a client that needs services. Here's that information. They'll be able to see all of that patient information. Also, it's HIPAA compliant, but even more challenging is it's the part 47, 42 CFR part 2, right? Compliant. Thank you. I knew I could. And so, and that's what that tool is incredibly powerful, because it makes sure that we're meeting all the rules, but then we can make the referral, and then we know the referral was made, they received the referral, and that they acted on it. And they have all that information from the patient with the patient's permission or the client's permission. So they are empowered to be set up with support. The next piece that we're asking for is a powerful dashboard where we can tie in. If you don't know what the problem is, you can't fix it. So we have this thing called First Watch, which will go out into our data, Teller County Public Health's data, any partner that wants to allow us to access their EHR, and it will use AI technology, closed AI technology, to extract that data and then share it in a dashboard. Who here spends a good portion of their time every single day trying to find a way to extract data? I do. I spend an exorbitant amount of time trying to understand the problem. This tool, First Watch, will actually scrape that data out for us and put it in a dashboard that all of our community partners can use together. So it's not actually a tool just for UpRat. This is about furthering collaboration and communication amongst all the partners, so we can understand the problem, so we can do referrals, so we can get support services out to community partners.
But that will the question, first question, that's
Okay, Tiny, here's the question. Draw me the picture of how this specifically relates to opioid crisis.
Absolutely. So we know that behavioral health and substance use disorder are inexplicably connected to one another, right? And so when we go out and we do behavioral health response, so many of the customers or the clients that we come in contact with have substance use disorder issues.
What's the percentage?
So I can tell you anecdotally, I can get you exact numbers because we do have that data. I don't have it with me. I can tell you anecdotally, it would be close to 40% or more.
Can you give me that
So,
data?
I absolutely will. So thank you. And I appreciate that question. I appreciate the time to get you the actual number.
Thank you.
Can you explain a little this funding? Is it going towards software, people to support the software, and then for how long? And what your sustainability plan is once this funding runs out?
I love every single one of those. There and so it's going specifically for the program. None of the money is going to be spent on staffing or personnel. We have the infrastructure in place to support the actual day-to-day operations of the services. So what this funding will go towards is the actual developing of the program and then getting it integrated with all of our community partners that want to be part of it, getting it integrated with their EHR systems or their computer systems so that it becomes seamless, so they can push one button within their system to make that referral. And then when they open up their system, that referral is sitting there. And then same with the dashboard. It's about setting up the AI technology so it goes in and it seamlessly extracts that data so that we can open up a website or open up a computer or open up a program on our phone, and all of our community partners, all of the members of the Teller County Mental Health Alliance will actually have access to that data. So the sustainable piece is being part of the Teller County Mental Health Alliance. If you are a member of the Teller County Mental Health Alliance, you will have an opportunity to share in this program and be part of it. And it'll be sustainable because there'll be a, after the introductory period when people really have an opportunity to see the value, they'll actually pay a membership fee or an annual enrollment fee to be part of the Teller County Mental Health Alliance to continue using those services and that product. Also, it will allow that funding will potentially allow us to have staffing to offer additional structural support to the Teller County Mental Health Alliance to allow it to continue doing the amazing work that it's doing. Does that answer your question?
Yes, thank you.
Thank you. Yes, sir.
Can you explain to me what service you provide? Or are you more of a connection and you give people the services?
Yeah, that's a great question. So we are the mobile crisis provider for all of Teller County. So when somebody calls 988, it's our team that responds. We de-escalate the crisis, we medically screen them in the field, and then we divert them to other resources. Other than that, also, we only have a small number of ambulances in our community. If everyone who called 911 got transported by ambulance to the hospital, we would be out of ambulances all day long. They'd all be down here in the Springs and there wouldn't be any up there. So about 50% of the time, we actually treat people in their home. We do it, it's called treatment in place or transport to alternative destinations. So we bring the urgent care to them because there is no urgent care in our community. So we'll come in, we can do lab work in their home, urinalysis in their home. We work with nurse practitioners that can order medications for them in real time. And then a lot of these folks are struggling with substance use disorder. So we can get them set up with our community partners for substance use disorder treatment. So.
And we do follow-ups too.
Yeah.
So we do the required follow-ups, but more than that. Following up, seeing if they've gotten connected within 24 hours, if they didn't go inpatient.
Yeah, and that's a good point. What Darlene does is she actually does 24-hour follow-ups on all of our behavioral health clients. And so if they didn't get that referral initially, then she is a case management specialist and she will actually help get them set up with those services, maybe even services that our community paramedics might have missed.
The initial questions, Commissioner Feldman.
Yeah, so it sounds like when you're talking about sustainability, the Mental Health Alliance is obviously a place for that. Is this, but that's kind of based on the fact that that all works out. So my question is are the folks that are currently members of Mental Health Alliance supportive of this and committed to paying for this on an ongoing basis?
So they're committed to sustainability. We are having those discussions right now around whether that is the best funding model going forward. What I can tell you thus far is what I've heard anecdotally is that if they see the value in the products that are being offered and we build it in a way that they see real value for it, then they would be fine with helping sponsor it and support it. So
how many people are currently members of that line?
So about well, I can tell you at the last meeting we had 25 active members. And that's about the minimum number that we see. There's obviously more people on record for being members, but the people that consistently show up are between 20 and 25.
But the referral base, there's at least 80 some emails that go out for this group. Okay, so there is a lot of collaboration there.
So, Shiny, first off, appreciate all the amazing work that you guys do because, truly a cutting edge organization for the state of Colorado, and some of the things that they provide. But what I'm wondering about, first off, this is a big ask. This is a big ask. So have you looked at, is there a way to do a phased approach of breaking up, what you're attempting to do and phasing it, rolling out? Can you get all this done in a year? This is a big apple and you're taking a lot of bites. What's your level of confidence that you can actually accomplish this all within a year and then just making a huge investment without knowing that there's a level of sustainability behind it? This board does not have that kind of money over the next 30 years, to keep that ball rolling. I mean, we can push a ball off the top. We can push a big ball off the top of the hill if it's sustainable, once it gets rolling. So talk a little bit about just the schedule of this. Is it something that could be phased? What's your development plan?
Yeah, and I'm sorry, oh, there it is. So, and this timeline is obviously gonna be adjusted because the deployment of the funds has been adjusted. So, the first thing we're gonna do is we're gonna conduct a focus group with the support of Joanna, to understand specifically how people would like their piece of the puzzle implemented. What systems are they using? How much integration do they want? What tools do they want to have access to? And then Jelana has a very large team that has built large programs like this before in a very short period of time. So they will actually go out, that implementation team, that won't be handled through our organization. That implementation team will go out and work with each one of those agencies to integrate the system into their system or set them up with access to the Gelata system so that they can start receiving those referrals. We become the hub, and then ours gets connected directly to Contexture, which is the statewide health information exchange, so that we can have access to patient information as long as we have a meaningful use reason to break glass. So the reason it's can be implemented in a short period of time is because a lot of the pieces already exist, and our partners have already done this with other systems before, other agencies before, including, I believe, El Paso County. And I don't want to, don't correct me if I'm wrong, I think Colorado Springs uses Gelata as well, correct? So, so we have, I mean, I was on the phone with Dr. Pinkowski, former ER doc that actually designed Gelata this morning, and he assured me that they absolutely have the ability to implement programs like this. And in the first watch, again, same thing. They use AI technology. They actually come in silently and extract that data with permission, and then create these dashboards. So how do I know we can implement this in a timely manner? Because it's been done across the country, and I trust the partners that we've selected. And there's a hunger with the agencies that are our partners to make sure that we have a robust referral tool so no one slips through the cracks, so that everyone has equitable access to care.
Once it's been built out and designed, how much of this cost would roll into year 2, year 3?
So, so year 2, and year 2 is just 116,000. And then what we've actually done is we're hoping by year 3, we can actually transition into being able to fund that ourselves. So, we're making a slight, audible on the request for year 3 funds. And we actually want to get the BD, system, for diversion avoidance for opioids and things like that, so that, at all of our facilities, we'd actually have active tracking of all of our opioids. Also, any Narcan that we distribute would be tracked, and we'd actually be able to integrate that into the First Watch dashboard. So in real time, we could actually see that information. How many opioids are being given, how many sedatives are being given, and then how many Narcan rescue kits are being handed out.
So this request actually covers like 2 years.
Yes, it would be 2 years, and then hopefully by year 3, it would be self-sustaining.
See 2 more questions, please.
All right, real quick. Connie, I'm curious, how many calls are you taking now, monthly or annually, or I don't know how long you've been doing this?
Yeah, so we do about 500 behavioral health calls per year.
Okay.
So, and then, but the important thing about this tool is it's not just about our organization. We want this to be a referral tool for all of the Teller County Mental Health Alliance partners to use. We want DHS to be able to use that to refer to people that need substance use disorder treatment. We want Teller County Public Health to be able to refer to Serenity Recovery for a person that needs inpatient or in-home substance use services, right? We want to be able to have all of these, and then we want community partnerships, not only to receive referrals, but we want them to be able to send referrals to other communities.
Got one more question tied to that. Are you currently billing for what you're doing?
So We actually receive funding from the state of Colorado through the BHA because we are the contracted behavioral health provider. So we receive, through, Signal Health, the Bahaso, we receive funding to be the, Teller County Global Crisis Provider. We are in the process of getting credentialed with CCHA, so we can bill for that. We also bill for, BHST, or Behavioral Health Secure Transport, for patients that are for clients that are appropriate for those services. Obviously, not every insurance, not every payer covers the cost of those services. Thank you. Great questions.
So if you respond to all behavioral health calls, do you have the data of how many have a drug or opioid nexus?
Yeah, that's what she was asking. I will absolutely do that research and get it back to you by the end of the week. Is that fair? I would absolutely be willing to do that. So I know it's a good number, but I don't want to just throw out there anecdotally. It's a good number, right? The other thing I would also say is this, is even a lot of folks who don't actively currently have an opioid addiction or a substance use disorder challenge, by addressing that behavioral health condition, we can avoid future self-medication by getting them set up with resources and services when it's a small problem before it balloons into a large one.
Okay, question back.
So what's interesting to me about what you're proposing is a lot of times what we are hearing from many of the folks who are asking us for funding is that we don't have a lot of great mechanisms for tracking outcomes. So my question is, when you're talking about referrals, how much additional information will come back in? How much will you be able to track kind of folks who are coming back into the system multiple times? Will it have the ability for you to do more of that tracking that could be valuable for us? And not only assessing the value of this particular tool, but perhaps assessing the value of those who are part of the Mental Health Alliance up there that might help us look at what is working and what would be beneficial for us to continue funding.
Not only will it have the ability to track it, my hope is that we could actually share that dashboard with the community, so the entire community can hold us accountable for those numbers in real time. Because transparency and accountability are absolute hallmarks of what we do.
And then one more, if we cannot fund you at the total request, is this project still viable? What is kind of the lowest number, or what is the threshold where this project is no longer viable if you don't get funding from this?
Yeah, that's a great question. So I think the easiest thing to get rid of, I mean, that's what we have to think about, right? Is the easiest thing to slash first would probably be the first launch dashboard. Unfortunately, that would be a huge tool. But if you ask, like, what do we get rid of? I'd say we get rid of the tool and we come back next year and we ask for that again. Maybe we approach our vendor and ask for a modified. So there'll be a cost to that. The cost is a lot of the data that you talked about, but you know what? Rome wasn't built in a day. So if we have to start somewhere, that's where we start. And then if we have to cut a second piece, I would say probably the second year, and hopes that we could find another way to sustain it, or come back next year and say, hey, look, we're just not going to be able to sustain it. Can we seek some additional funding to sustain this for another year? So I'm absolutely willing to work with the team to figure out a way to make it work.
What was the second one you cut?
The second year of funding for the signal tool. Yeah. And I'll tell you guys, that's not ideal, but I absolutely understand that there's a lot of good organizations here that have a lot of really important requests. And we are absolutely willing to be a good community partner. And if we need to cut back on our request, we will.
Okay, any final questions? Thank you.
Thank you, everybody, and I will get you guys that data. Thank you so much.
Okay, next up is the Phoenix, we're 3 minutes behind schedule. Over it, 3:10, the Phoenix is scheduled at 3:13. Phoenix is asking for 500,000. And
Todd Jones, I'm the Senior Program Manager of Strategic Initiatives. And what that primarily means is I work with people that come out of the criminal legal service. The Phoenix is a national organization. We've been in Colorado Springs since 2010. We're the second location that the Phoenix ever opened. Now we're coast to coast, all over the country. And what we do is we build community through free services. So if you have 48 hours clean, sober, directly before you, that and we need activities for you. We do everything from CrossFit to music to yoga to hiking and so forth. Really introducing people to new playgrounds and playmates. So I'm a Colorado Springs native. I've been sober for 15 years. I was also a graduate of drug court here in Narcotic County. What that means is I've done my recovery here, but I also did my running and gunning here. And when I got sober, I didn't know what active recovery was. I was very aware of what addiction looked like, but I had no idea what recovery. So when I went to my first Phoenix event, I was like, oh, this is what life could look like. This is what I can do. I really have no idea. So I've been with the organization ever since. We've been serving people coming out of the criminal legal service very organically. We're well positioned to do so. One of the things that we wanted to do is approach this more strategically. So Nick Wells, he's one of the volunteer managers here in Colorado Springs, was incarcerated for many years here in Colorado. The day he got released, one of our staff members knew him. And Nick had done really well in prison. He was getting out for good reasons. But our staff member drove down, picked him up, and took him to his first Phoenix event because he knew that was a crucial crossroad for Nick to either go back to his old community or find a new one. So he brought him to his first event. And I thought to myself, like, and the organization thought to itself as well, how do we replicate that for any individual that's involved in drug court, veterans trauma court, family heals court, probation, parole, coming out of prison? How do we replicate that and help them find a new community? So we built our own program. We send virtual classes into prisons all over the country. People get a lot of exposure to the Phoenix. They kind of know what it is. It's a soft, what the Phoenix is. We want to target drug court, and the way that we're going to do that is with volunteers. So part of this grant is we'll train 30 volunteers with lived experience of incarceration and legal entanglement, and help them be a cultural guide to people that are coming out of or involved in the criminal legal service. And then the last piece is our new format, which we can load up partner organizations on that provide the services that we don't. Maybe somebody doesn't need a workout, maybe they need a place to live. Right, we'll help you find that through our partner app. You can give one of our partner organizations, help you find work, whatever the case may be. Your grant to us will be scalable, 100% scalable. So one half our metrics will follow accordingly. So. Budget. Yeah, budget. So 1/3 will go to staffing costs, 1/3 will go to program costs. So that would be certifications, punch passes at City Rock, climbing gym, so forth, things like that. And then 1/3 goes to our new format and marketing.
So with that, thank you. Open up for questions.
Is this request to increase staffing or pay for current staff?
Will be an increase in staff, and we will have some contractors that we'll hire, but no increase in staffing.
Just no questions.
Also, just to dovetail off that, I don't think anybody's salary will be 100% funded by this. There'll be some portions.
Any additional questions? I'm sorry.
Yeah, just going, to kind of outcomes, it's the one thing that's a little bit hard to tell, what would be the things that you would highlight in terms of people who go through your program, what they end up where, what would be promised about of what you think?
Sure. I mean, obviously the gold standard is we help them to maintain sobriety. And we've got data to show that if somebody goes to a Phoenix event at least 3 times a week, they're 90% more likely to stay sober than 10. So it's a pretty big win for us. We have a really good database that we can track pretty much pretty much. I mean, when they come in, we have our intake paperwork, where they're coming from. Are they coming from a criminal legal service? They just find us, where your citizen finding us, so forth. And then we can track them through their lifetime with the Phoenix. One of the things that we like to see most is an engaged member, which is at 3 times a week. The other thing that we like to see is volunteers. When somebody gets to the point that they're ready to start giving back to their community, a lot of times they just try to see something else.
Okay, so
Yeah, so a lot of this looks like kind of a straight funding request as an established organization, just, looking for additional funding to continue, to do operations that you've already been doing. How many currently, how many events do you have planned for this calendar year or whatever you use as a calendar year? You talked about over 1,000 total events. What does it look like for this year prior to receiving this?
Sure, we're currently in the hundreds, I know that, I can pull up the app right now and geolocate, so if someone was going around me, I can more thousands. The little slightly difference is that this is a strategic approach to serving people involved in criminal legal service. They're already finding this, but we really want to serve that.
Okay, and similar question to what was asked of the previous applicant, which is, would you be able to still leverage and improve services, improve offerings with a lesser funded amount?
Yes, we're 100% scalable on this, so like I said, like we use 1/3, we'll just bring our metric staff on.
So, thank you.
What's your recidivism with your justice involved?
Pardon?
What's your recidivism with your justice involved?
I'd have to get that data for you, so I don't have something.
Do you have where someone has been a part of the program for a certain amount of time, they start to then invest and continue on? Where that previously we heard about for 60 days, you can stay for free, but then we want to have you start to build and invest and understand personal responsibility.
We do that through volunteers. So our programs are always free, but we do encourage people to volunteer. A lot of times we'll pay for certifications that they might need or something to meet that. They even pay for themselves. And then when we do our big national trips, like we take 250 people in the lab, those volunteers are there working alongside the staff, free of charge. That's kind of the way they give that.
What do you think, and this anecdotal is fine, what's your ratio of paid staff versus volunteer roughly in this program?
Very low. We've served almost 1 million people here at Global. In the organization, we have about 120 staff. Let's say program staff, that's probably about.
And volunteers, how many volunteers?
It's a great question. Well, I think it's around 100,000.
Okay, so very, very volunteer based.
100% almost completely volunteer driven. Our staff rarely deliberate pots. It's almost all volunteers.
So, yeah, one other question. Everything you've talked about today, is that specific to the Pikes Peak region? So anything that you would be doing with programs, a number of programs, all that specific to Pikes Peak region? Correct. Thank you.
Any final questions? Thank you for your time. Next, we have community for hearing. Insurance to 280,000.
CEO and founder of Community Anchor Academy for Wealthy Unlimited.
My name is Dominique Thompson. I'm the site director of Wealthy Unlimited.
So, kind of give you a brief synopsis of how we got to where we are today, why we do what we do, and essentially what we're asking for to continue to support the work that we're doing in our community. And so, as I mentioned, I'm the CEO and the founder of the organization. Before any of that, I was a young man convicted of drug possession at the age of 18. I was raised around addiction and deeply impacted by the overdose death, close friends, and most recently, the tragic loss of my brother and best friend, influenced by opioids and alcohol. That pain became my purpose through reflection and a commitment to wellness, built Wealthy Unlimited, which is a gym and a juice bar that heals body and mind, and launched Community Anchor Academy to give others what I never had, which is a real path to learn, earn, and give. So the question I'll pose to you guys is, what if I told you we could potentially reduce relapse, cut recidivism, and help prevent overdose deaths and grow the GDP with the gym, a juice bar, and a job? Sounds good, right? problem that we're facing is that whether you live on the east side, the west side, or right downtown, or southeast part of town where I'm from, we're facing a huge increase, 52%, I think to be exact, over the last 5 years in drug overdoses. Fentanyl-related deaths have quadrupled since 2019, and we're seeing overdose victims as young as 14 years old. More specifically, in our community, in the southeast part of town, Black overdose rates in Region 16 are 40% higher than the state average. Latinx youth are disproportionately represented in the justice system, and 80% of our participants are navigating substance use or reentry. So our solution is learn, earn, and heal. So it's 3 steps that we provide. First one is the rapid assessment. So as soon as you come in, we provide assessments. We have the DESI, which is the barrier to the Employment Success Inventory. Of course, we have your GAD-7, your PHQ-9, PCL-5, all those things. We also provide an insight tool, but something that really sticks out is we provide called the Ikigai, which is a Japanese term, which helps you define your purpose, right? We help you get, there's 4 questions to look for, right? What do you love? What you're good at, what the world needs, and what you can get paid for. And through that cross road, so to speak, is where we help find and identify your purpose. The second step is rapid job training. Everybody that comes through our doors, they get job training, soft skills. We do forklift, warehouse, pre-apprenticeship to construction, sales, customer service, and sales, trauma-informed care, workplace wellness, conflict resolution. So we embed a mindset of fitness and healing into every session. This isn't just workforce development, it's therapeutic employment, where the classroom becomes clinic and the curriculum becomes transformation. The third step is what we call our paid interventionship. I didn't say that wrong, that's interventionship. That's a term that we coined. After training, participants move directly into paid roles at Wealthy Unlimited, interning in customer service, operations, and team leadership. They're mentored by certified peer support specialists and individuals who have the QBHA. And then they're supported by our STEAM, sweat, and self-wellness framework. They're not just getting a paycheck, they're building identity, structure, and dignity. They learn, earn, and heal all at once. So what happens if we don't get the support, right? Overdoses in El Paso County have skyrocketed from 146 deaths in 2018 to nearly 300 in 2023. Colorado's recidivism rate remains at 43%. What happens if we do get the support and continue to do the work that we're doing? We'll be able to fund 20 paid recovery traineeships. We'll hire a career and wellness navigator, the FTE of 0.5, so to take care of half of their payroll, and expand our peer-led recovery and job placement program and keep our recidivism rate under 5%. So for our entirety of our program, our recidivism rate is about 4.5%, 5% on a bad day. But within the Wealthy Learn, Earn, and Heal program, we're about 2%. So with that, we'll be able to strengthen Region 16's trauma-informed workforce ecosystem and continue to do the great work. So we're asking, call of action that we're asking for to interrupt overdose and relapse and replace despair with purpose. Thank you.
So that will open it up to questions.
How long have y'all been around?
We are going on our 2nd year, but prior to that, we were an organization that started in 1995 called Denver Works that went to Community Works. And when we decided to add the health element to what we did, we were coached into becoming our own entity.
Okay. So how many people are you currently serving?
Right, so we currently serve, this year we're going to serve over 1,000. Right now we're averaging about 100 participants that we're working with as far as youth and families.
Okay, and so your recidivism rate, that's of that total 1,000 people, those are all justice involved. Like define recidivism from your perspective.
Absolutely. So currently we do the wage grant through CDLC, so we facilitate that. And so for us, what recidivism looks like is individuals that can charges after they've been released incarceration.
is there a certain period of time? So since you've only been around 2 years, are we talking, within a year or what is that occur?
Yeah, for now, metric we've been using is for a year, being that we have data going back as far as 2017. Prior to us going off and doing our own thing, we also include some of that data if necessary.
Talk to me about, obviously this is pathway to work, career, and kind of sounds like both physical and economic health, talk to me about your partnerships, within the workforce community. How are you achieving the placements out of your approach?
Absolutely. So, first thing we do, we identify potential employers we would like to work with. From there, we get their core competencies, and then we make sure that our trainings are, consistent with their core competencies, and then we provide that training that supports them moving forward. So, I think the term that we coined is called the hit job market. So we do all the interviewing for our participants prior to us sending them there. So when they go there, they're guaranteed an interview.
And for the work that you're currently doing, you talk about the numbers of people. Do you see that if this funding is provided, that you'll be able to expand what you're doing? Is that the goal of this, or is it to continue what you already started?
Yes, it's to expand. Currently, right now, within the learning and healing program that we have over at Wealthy, we're able to have, I think, 2 participants every 3 months to do the work-related program. And through this grant, get us up to 4.
Okay, and what's your organizational structure right now?
We are 501c3. Community Anchor Academy, 501c3 that owns Wealthy Unlimited, which is a LLC.
You're very heavily funded by grants. What's your plan to move beyond that and be more self-sustainable in case you lose a big grant or you don't get a grant?
Yeah, so we're also equally funded by the Medicaid programs that we provide. So we do a lot of what do you call it? Life skills trainings and things like that allows us to bill for Medicaid. And also we have built a strong relationship with local foundations too that support our work.
Any additional questions?
Thanks. So how long would these positions be funded for? The 20 and the 0.5 FTE with this funding? How long would that sustain those positions?
So the way we worked it out is, believe it's a 3-month program for the quarter, right? And then we help with them transitioning to a more permanent position job. So the program lasts up to a year, but as far as working Wealthy, that it'll be 4 people to a cohort, will last for 3 months.
Okay, so sorry, I thought that we were supporting staff for you to then go work with the individuals, but this is supporting the individuals directly.
So we'll be hiring 1 staff, right, in addition to what we already have. That we have 0.5 FTE to help with the new participants.
And part of that funding would be for a year to sustain that position. Thank you.
Any final questions? Thank you. So we had purposeful change. 1,640.
Yeah.
I'm Brian, I'm the CEO and founder of Pikes. This is Morgan, the insurance board person and also the account.
Yes. So I guess I'll just rattle through just for a little background. Organizational structure wise, we're 501c3. As far as paid employees go, it's Brian and myself part-time. We're funded through the House Bill 1287 and the Senate Bill 202 through Signal this year, last year Diversus. So we've been around for about a year, we've been funded for about a year, so we've been offering services. In that amount of time, we have created 7 recovery groups, and we have peer coached in that 1 year, 1 fiscal year period, 56 unique clients.
as it's just the two of us. We are volunteer supported, so when we do things like work with some of our community partners, like the Lovely Hope COS, to, you know, be present in their warming shelters during the colder months of the year, or with some other community partners that are directly involved in boots on the ground outreach. We are supported by a team of volunteers that will join us. We also work primarily to fill the gap in the continuum of care that we've identified within the homeless or at risk of becoming homeless population. So we can facilitate through community partnerships that are very strong, the placement of people into sober living homes, into rehabilitation, inpatient clinics, into detox when that's necessary. And a good example, I think, of the way that we've kind of orchestrated that programming is the development of a program working directly with Landmark. They are El Paso County's only Medicaid funded inpatient rehab facility. And as such, since they're billing Medicaid, they can't traditionally offer peer recovery coaching services or things of that nature because, you know, we can't double bill against Medicaid. And, you know, most people in our field do need to still make a living, even though, you know, the work is close to our hearts. So our grant funding does allow us to do some of that with those types of community partners. If you wouldn't mind the next slide. Thank you. So really we act primarily, Brian and I, as resource liaisons needed for people who are homeless or in transition. We do work directly, boots on the ground, kind of down and dirty, nitty gritty, you know, out walking the streets, talking with people. We have some established connections inside of the homeless community, which is something that you don't often see in El Paso County. And in Teller County, we were able to expand our services in Teller County, conducting virtual groups and then also boots on the ground outreach. So this is for our proposed programming for this fiscal year. We measure our fiscal year June to July. We want to continue our outreach within the recovery community and within homeless populations. We are working on our PHE license right now so that we have the option to bill Medicaid for sustainability purposes. But this type of grant funding does enable some of our niche programming that requires that we are not billing Medicaid. And so we anticipate we'll reach an additional 1,200 homeless individuals with the funding from this council. And this last fiscal year, we reached just under 1,500. So it'd be pretty close to doubling the impact that we have. And then we estimate that with the ability for us to go full time with this council's funding, we would be able to place 96 homeless individuals into sober living or detox facilities, and then subsequently into sober living, and kind of hold their hand and follow them through that process and provide all of the things that are necessary to make that possible, like access to resources like a driver's license, getting a new birth certificate, a ride to the detox center, and then from a detox to sober living, sort of all of those pieces that don't really exist in a comprehensive way for people who are finding themselves at this level of homelessness. We also plan to, with this programming specifically, establish more of those key partnerships like the one that we have with Landmark, inside of inpatient facilities, inside of the drug courts, and then inside of other sober living homes that we've not yet had exposure to. And then go to the next slide.
You're supposed to do.
Okay, no, that's okay. The last slide is just a conclusion, but I think that really encapsulates most of what Brian and I do.
Right, thanks. With that, we'll go to questions.
So, I think I know, but I'm gonna ask you the direct question on it is, what changes for you with this funding that, you're showing 18 placed into sober living facilities in the last year? Now you're saying 96, that's a 4 to a 5-fold increase, with only roughly a doubling of the number of people that you're reaching. So what changes for you, and how do you substantiate this, this projection to, you know, to quadruple or even quintuple your success in getting people placed in sober living facilities?
Yeah, absolutely. I think the majority of that is made up of, us, this funding enabling the two of us to go full-time. And then also the hiring of one additional peer specialist, CPFS, QBHA.
And we ended up seven that are in training.
Yeah, and we have scholarship through and used as volunteers 7 people that we have personally gotten trained through our programming as sort of their next step away from recidivism. But the 96 in sober living, that does kind of, that increases more disproportionately because of these key partnerships that we intend to establish and the ability that that would have to really fund more outreach for us. So if we can do more boots on the ground outreach, then we can reach more people who need to get to detox and or sober living.
Thank you.
Any additional questions? Okay, thank you very much, sir.
Thank you.
Next we have. Right, 1,279. 79.
Good afternoon. My name is Nicole Weiss. I'm the Director of Healing and Community Programs at the Lyda Hill Institute for Human Resilience, IGCCF. That's one title. Drugs.
Hi, I'm Brooke Johnson. I'm a neuroscientist who studied drug addiction for over a decade, and I'm the Research Program Director at the Lyda Hill Institute for Human Resilience.
Our proposal today is to expand our already established GRIT program into a substance use recovery module. We launched the GRIT program, which stands for Greater Resilience Information Toolkit. We launched it in 2020, right as the pandemic was coming down. GRIT is, the best way to describe it is a basic first aid for social support. It is a very easy to use, self-navigated class online, completely free, that anybody and everybody can take to learn how to reach out and make very meaningful, helpful connections to your already established network. We have worked with several different community partners to continue to expand GRIT throughout the 5 years, and we've had throughout those years continued requests for a substance use lens on this. So with this proposal, we would like to expand that into this other realm with substance use and create a module called GRIT Recover, which would be intended for friends, family, and loved ones of those in opioid use recovery or who are currently using, to be able to increase some of the social support going towards that population. What research has shown us is that one of the highest markers for recovery after stress and trauma is social support. So GRIT definitely helps enhance that ability. Within our proposal, we have a couple different key objectives. One would be, of course, to establish that GRIT Recover module. We would be working with the expertise from Serenity Recovery Connections on some of that consultation for expanding that module. We would also add in an opioid prevention discussion within 2 of our other components of GRIT, GRIT Core, which is the track that everybody takes, as well as GRIT for Ed, which is our education lens for GRIT. We would also be enhancing our already established GRIT E, which is our mobile app for GRIT, where we would add opioid prevention discussions, social support strategies, as well as different resources. And then we would also like to continue to partner with Serenity Recovery Connection to send in some of the individuals who go through the GRIT training into their craft program to continue to extend those GRIT coaches' knowledge of support strategies. A couple of different key data points that we would be looking at. Of course, we do aim to increase the number of people who are in the GRIT program. Last year, Mayor Yemi Mobilati established a goal of becoming the first GRIT city in the United States, which would be the goal of having 25,000 GRIT coaches within the Pikes Peak region. We currently have 2,500, so we're working towards that goal right now. We have over 5,000 users in this program worldwide, about 40 different countries. We would also be looking at increases in connection, social support skills, confidence, and increase in resource referral within those GRIT coaches as well. That's 3 minutes. You told me 3 minutes. We went to grad school. We got this.
That was for questions.
Yes, we seem to be very Colorado Springs centric. what work have you done or plan to do for rural Placer County, Teller County, Woodland Park?
Sure. So we would, within our proposal, we did some marketing, as well as in-kind marketing on our side as well. The grit, sorry, let me rewind. Grit has really expanded through snowball marketing, which means somebody knew about it, told somebody else about it, told somebody else about it. We have done very little marketing for this program. We did have a little bit of funds from ARPA back in 2022 that did allow us to expand out some of the knowledge within Colorado Springs. So part of our goal with this would be to be connecting with different agencies, different recovery organizations throughout our region to really share this program. It's free, which also means the system we're using is free along with an in-kind rental for a server. So some of our strategies have been to use in-kind and snowball marketing.
So that's your goal. What's your plan to reach out to Teller County, Woodland Park? Obviously, the Placer County Sheriff's Office.
To be contacting the different organizations that work in recovery. So doing A to B marketing. Yes.
Yeah, CJ, currently you have 5,349 users. How do you define users? What is an active user? And if you know, how many active users do you have? Because I mean, I'm a user of the McDonald's app,
Right.
but I'm not very.
Right, very good.
I might use it once or twice in a year.
We look at how many individuals have signed up for the training. So that is over 5,000 in the world who have signed up. And that's the first kind of marker that we look at. We also do send follow-up surveys, what we call it contact surveys, to everybody who has signed up for the program to ask, are you making any of those connections? Are you having some of these great conversations? Our sample for that is fairly low, or our response rate for that is fairly low, so we don't track that up as deeply.
What really got my attention about this program is it's probably the only one that I've seen that actually has a significant piece in it in regards to family support, which is a bit unique and actually I wish space on us. Anyway, one of our family members was here to ask questions. Yeah, thank you. But talk to me a little bit more about what that looks like and for the outcomes for families and for substance use disorder patients.
Sure. So as I said, one of the key recovery mechanisms after stress trauma is that increase in social support. At the same time, what often holds folks back from increasing social support after stress is not knowing what to say, not knowing how to have this conversation, not knowing what to do after the conversation. So what GRIT does is it provides 5 very simple steps in having this structured conversation around support recovery. So to being able to provide that structure for family members, how do you start this conversation where this might feel uncomfortable? How do you really enhance strengths that the individual is already portraying and really work that into a conversation around recovery? And of course, what are the resources behind that? One of the reasons why we really want to partner with Serenity Recovery is they are some of the experts already in this field. So we want to be able to lean on some of their expertise in guiding this curriculum.
I can also tell you that we've done a study on GRIT coaches and the outcomes and the people that have taken the training, and we see that 95% of the people that have taken the training feel more confident in their ability to approach their loved ones with the help of conversation, and more than 90% also in applying those skills in future conversations. One of the really interesting outcomes from the GRIT program is that the coaches, the people who have taken the GRIT trainings, actually have really high or significantly improve their mental health through the training. So they show lower PTSD, lower depression, lower stress, higher levels of belongingness. So it's really helping their mental health and they're being able to help them.
And is this scalable in a way that should you receive less funding, you can still be able to move forward and have an impact?
Yes, in fact, we actually already adjusted our budget slightly. We were going to do a screening of a film called Inheritance. Since we put in our proposal, we actually got feedback that that screening wasn't as well received with some of the population as we would have preferred. So we actually took that.
We can also fund the development of the GRIT modules separately from the inclusion of GRIT Recover into the mobile application. So those can access.
Thank you.
Maybe I missed this and go, I'm sorry.
I was just gonna say, what was the email?
Inheritance.
Go ahead.
Are you good? Maybe I missed this I know what grid is, and I know what the resiliency program is, I know all of that. And I know you're working with Serenity, but specific to opioid crisis, specific to this council. Are you changing? That's what you're changing from the resiliency grit to this grit is more focused on just that.
We will not be changing, we'll be adding.
So you're gonna add to the resiliency, those components directed specifically to. I'm just,
Yes.
okay, yeah, using the information from Serenity.
As well as our own expertise as well. I'm a licensed admissions counselor and biggest case hero.
Right, but I mean, like with their day-to-day, but with your whole knowledge of it, I'm just making,
Yeah,
just getting clarity.
Yes,
absolutely.
specific to the opioid crisis.
Specific, okay, thank you.
Within GRIT, anybody can sign up for it. Once you sign up for it, you have access to the entire training, which includes the GRIT core. So everybody will take the training that tells you how to reach out to make some of those connections. Within the GRIT core, we'll be adding some language around if somebody is exhibiting negative coping skills and or coping mechanisms, and how might you start to support some recovery discussions already there. And then we'll be creating an additional module specific to recover with opioid specificity. And then also enhancing our GRIT for education, which is similar, but it's aimed towards educators. So also having some of that language in the education field.
Thank you.
So I believe, I mean, you basically take that 4 and you've already rolled out several other programs. I know you like first responders, you have that, and you've got a couple of other. Could you name a few of those that you've kind of already like tailored?
Yes. So we have 4 additional modules currently. Also, this is all available in Spanish at this point as well. So in addition to core, we have GRIT for leadership, which is all geared towards leaders and small business owners. GRIT for healthcare, GRIT for education, and GRIT CERT, which is geared towards military and emergency responders. Later this year, we'll also be rolling out GRIT Tribe, which was focused on Native American women. GRIT Caregiver is coming hopefully next month, and then GRIT Teen. We've been working with several different entities for each one of these expansions. We don't expand without bringing in some expert opinion and voices into this. So with each of those expansions, we're working with different community groups. A lot of that happens to be in kind.
Yeah, so I'm not as familiar with this program, so a couple of questions that may be obvious to some. One is a great coach is just someone who utilizes the app.
Yes, the program. So right now it's both online program as well as an app you can access to.
Okay, and so I'm kind of viewing this a bit as a self-help app. Okay, so and so to kind of get down to those same things around the opioid use, you're essentially providing a self-help for those who might be dealing with people around them with opioid use disorder. So, and again, how will you know that this is having an impact? How will you know how many people that are being impacted? That is the part that I'm really struggling with.
Sure.
Because especially because your program is so wide, are you going to be breaking down the number of people, that are taking those modules? I mean, that's still pretty indirect. But you mentioned Serenity recovery. So will there be other ways of tracking what the impact is of this self-help tool?
Yes. So 3 different ways. One is with the hopefully 20 folks that we would send in through the craft program. We would do some evaluation on the experience with both of these programs. We also do have the ability within our learning management system to look at who is accessing each of our individualized tracks. So while it can have access to everything, we can do some deep analysis to see who's looking at each of those tracks and then contact them more directly. And then within our GRIT app, we also have the ability to send emails that way, and they can plug in real time the number of contacts and the type of experiences they're having with somebody. So within the GRIT app, plug in, I spoke with Brooks on this day, I'm going to follow up with him next week. So they're all organized.
Maybe adds a whole nother question to myself. That's a lot of personal data, I suppose, that's being, so how do you safeguard, how do you make folks comfortable with putting that kind of information into the app?
Sure. It's not clinical, so this is not, we do not have any kind of HIPAA guidelines around this. It's not clinical. This is purely social support. You do not have to report real names. In fact, we suggest within the app that you do not report real names. So while I said Brooks in the app, I might call him ER or I might call him Bear or some other nickname. so that I know who I'm checking in with, but it's not necessarily reportable, and nor do we look at the names that are people are collecting in. It's just for their own self-use.
It's self-reported.
Yes.
It's up to the individual to report it for you to get your outcomes.
Yes. Similar to basic first aid, you are not obligated to help somebody that you come across. It's just a nice thing to do. So in a similar sense, grit is that nice thing to do. It's that call to action that if you see someone struggling, if again, your loved one is struggling with something, it's that call to action to say, stop, reach out, have that connection. Don't be scared, because it doesn't have to be that hard. And there are so many amazing resources that can come in next, just like CPR, just like a doctor would for mental.
No, I understood that. I just wouldn't know how you're gonna get your data outcomes is because it is self-reportable. It's up to someone to actually do that. I get it. Thank
We
you.
do push out a survey to people. And we can do that through the app specifically for the individuals that are engaging with the Recover curriculum.
Any final questions? Okay, here it comes. I want clarification. Is your budget number changed, you said, since this?
It's gone down slightly.
Yeah, that's what it is.
Yeah, I have that number.
Yeah.
Thank you.
And last, before we take a short break, is the Charlton Police Department. Yeah, I asked what you thought the list that was given. I don't know, I'm like, he's gonna present us. Who thinks so? Yeah, good.
Good afternoon, everyone. Thank you for having this opportunity to talk to you. We actually, the chief advisor for this program in operational readiness for police officers of Colorado and Washington State. I'm here to support the initial grant request, which is through the Fountain Police Department. But I just want to emphasize that this training is available to all law enforcement agencies. That's also available for public safety organizations, fire, EMS training, and the other modules that I'm talking about today. It is sponsored through the University of Colorado, Colorado Springs. They do sponsor all of this. In fact, the training is 4-hour online training curriculum that is all online, and it doesn't have to be done at 4 hours at a time. It can be at your own pace. The grant request is to cover the tuition costs of first responders getting that training, and also making sure that the certification they walk away with is literally frameable, and it's worth passing on. So UCCS has done a really good job for professionalizing that aspect of it. The program was designed by Z School, and Dr. Sarita Levy, who's the chief learning officer, has been working diligently for the last couple of years, getting this program going nationally across the country. I became involved in this last November. I became kind of passionate about it. I was asked to be an advisor to help evaluate the program. As I looked at the program, having been in law enforcement for 3 decades and some of the skill sets that I picked up was also being one of Colorado's first drug abuse experts instructors, and was very, very heavily involved back in the 90s, putting the drug evaluation classification program out there on the streets for law enforcement. So I became passionate about this because I've seen firsthand, as a law enforcement professional, the impacts of narcotic analgesics. Narcotic analgesics, it's a very large category of opiate-based drugs, including our biggest problem right now, which I don't need to tell anybody, is fentanyl. Nobody's taking the time out yet on Oxycontin and heroin. I mean, those drugs are still out there, and when a user is taking those drugs, the officer on the street's not being able to really tell the difference, because it's still opioids. It's opioid that's causing that problem. So this training is basically designed to teach a different approach to how law enforcement interacts with these situations as they come across it on the street. So the primary emphasis is about de-escalation and getting these people to the right resources. I heard
a lot of great presentations today about some of the resources that are available in the community. But our first responders may not know that information. So this training provides opportunities for them to learn where these resources are, how to get these people off the street and into the right location so they can get the proper care and treatment that they need. Same for fire service. The modules it's all standardized, and what's important about that is police and fire are often on the same calls for service at the same time. So it's important that everybody's on the same page. So both modules support that function, and which minimizes the misunderstandings and helps get these people faster response time when needed. Just one more thing to say here. The last thing I really want to point out to you is the handout that I gave to you. You should have a copy of the handout. I'm not going to go over every aspect of it, but it gives you a little bit more about the program success that has been happening around the country. As of right now, the National Advisory Board is made up of 300 law enforcement professionals and fire professionals from around the country. I just got the numbers last night that we have right now over 36,000 officers that are currently receiving the training throughout the United States, and there's more happening every day. We are post-certified now in California, Texas, New York, Florida, Illinois, Georgia, Arizona, and Pennsylvania, and efforts are underway right now to get to Colorado post-certification as well. This all helps legitimize the level of training, so law enforcement agencies know that this standardized approach is happening nationally. So in other words, people in Colorado Springs are the same training that the people in the city of New York. So it's standardized across the board. And there's more information here. I'm willing to answer in the interest of time, and let's get late. So I just wanted to just say that this training is very effective training. I've gone through it myself. I went through and I looked at it through 3 different lenses before I decided to jump on board. I looked at it as an administrator, also looked at it as a DRE, also looked at it as a trainer, post academy instructor from the officer safety point of view. This program covers all of those areas very effectively. So officer safety is definitely covered. The information that's provided about fentanyl is accurate. I can verify that through the DRE program that I was involved with so many years. And then as administrator, it's physically capable because of these type of requests that Fountain has put in for it, that other agencies can put in for as well, that the open funding can't cover. You can track one out for two for questions. Sir.
So in comparison to this, it speaks a lot about de-escalation. Compare this to classes like CIT, negotiations level 1 or level 2. What would make this, I guess, an easier path for some deputies or officers to take versus CIT? Because CIT seems to be like the biggest hot button.
Yeah, I'll be honest with you, I don't know the details of that training. My guess is that it's probably going to be paralleling. It's going to be very similar, offering some of the same techniques. Again, this is more about how not to escalate a situation, how to talk to these individuals, get them to the show more empathy, try to get them to the right resources. Calls for service are not good in any sort of us. So we got to do everything we can. We can't arrest our way out of these situations. We got to involve the community resources to deal with this problem. Especially everybody's understaffed. Calls for service, like I said, are stacking. We got to find a methodology that's standardized across the board and that communicates both public safety, police, and fire, as well as law enforcement. Very short questions. Yes, ma'am.
You have a question. So when I was reading through the grant, there was a lot of focus on the stigma reduction, acceptability, and that kind of training. And then I think I heard something different today. It's training across the board, and then the California, Texas, New York, Florida command. So I reading the grant specifically to officers here in our region, to the services that we provide in our region, connecting them to those and working with the stigma reduction and whatnot, does not translate to a nationwide training. So just help me understand how that's going to be specific I think more training and as much training is excellent. That's great. That's my concern is what exactly is the training?
So the training basically, brochure on the very first step gives you a real quick snapshot of what that training is. It's a 4-hour online training, like I said, it's self-paced. And it's monitored not only by Z School, but it's also monitored by UCCS. So that training is online, so it's a chance for interactive interaction between officers from across the country. So they get a dialogue with each other. They say, hey, how are you guys handling stuff in Maryland? Here's what we're doing in Colorado. So it gives that opportunity for that communication process to begin and creates a dialogue. So all in all, it's about, these are recommended steps. It's up to each agency to develop their own policies and procedures on how they want to proceed with this. But I guess the emphasis compared to where we were back in the 90s is we're trying to remove that stigma of these are just drug users. Why are they worth the problem? We need to get these people some help. And I hope that answers that question.
Yeah, to some degree, now that you mentioned the online, so it's 16,500 for 4-hour classes. That's how many officers or how many?
I would have to look at the grant request to give you that specific.
That's gonna be for 68 officers for tuition and paying the officers the overtime to take it due to not pulling them off the street.
Thank you.
And this is specific to your police department?
Yeah, the funding, yes.
Okay.
And that's just specific requests. And I just want to emphasize that this is available to all agencies, again, across the country. And that's what this program is designed to do, is to support that. So we do have standardization across from state to state.
Okay, that makes sense. It is specific to your particular job.
Yes, the cost of funding is for the 60.
Okay, thank you.
Additional questions? Should I?
Have you actually taken the training or have you seen it?
Do you have any current crisis intervention training right now?
Probably more than half of our department.
Okay.
Additional questions?
I actually have a question maybe for the other law enforcement in the room, so if that's okay. I'm kind of curious because this is very specific to law enforcement. If this is a training you guys are familiar with, if you've utilized it or you use some different type of training.
I haven't actually seen this training before. That's why I started asking questions specific to it. CIT is usually a 3-day long course. I know there's with CIT, I can't speak for El Paso or Woodland or any other agency, but Teller County, we're probably around 40% of our staff is CIT trained, and that's a 3-day long course dealing with specific crisis and crisis intervention.
Yeah, CIT say we're probably in the 90 percentile for training. I'm not familiar with this, so I can speak to it.
I even heard him mention Florida, and I've never been if it's not there. I haven't heard of it here. Much like the other guys have talked about standardized CIT training, that is pretty much the standard. Our folks are all through it except for our brand. And those classes are very.
So maybe that's something in the future was like, where did Fountain find this? Why this particular course versus some of the other things? Those might be good things to come back with for us to understand why this particular course.
Brandon, it would literally be the same, because I haven't personally heard of it, and at least it feels like CIT is kind of the industry since several years.
I'm sorry, I didn't mean to cut you off. You weren't in uniform, so it didn't immediately register.
But
You look different in one, so. This is just, would you be willing question? What if you'd be willing to pay the $450 and put a person through it and give us an evaluation back on the course? Joe's too busy.
I will take that back to my chief.
Okay, there you go. That's a good answer.
yeah, the administrative, the advisory board members were all given the opportunity to go through it for no charge, so they can provide feedback. It is a fairly new program to Colorado. It's been kind of born on the East Coast. It's slowly evolving this way. That's not unusual for these type of training programs. We saw the same thing. Just recently became, to answer the board, it was just recently this past year certified and posted in Florida. That's probably why it wasn't there. It's a brand new program. It's again, I wouldn't be standing up here before you, but I honestly didn't believe that this was an effective program and it was accurate and it's cost effective. And I really sincerely believe that it's a good step forward. It's the only reason I'm standing up here. I'm passionate about style. This is training is always one of the first steps. Getting fire and the police to work together on the same page. Because we have different dynamics and how we function. It's really important to get everybody operating at the same level.
On clarity's answer, we certainly was not a characterization of the program. I was just responding to the commissioner's question.
Okay.
Yeah.
Thank you. I was just trying to hit the highlights today. It is much more involved, much more in depth. But again, those are great points. Hope I address those issues.
I have a question more for the process that, with all due respect, will you recuse yourself from this specific vote then? Okay, just for the room's awareness. Thank you.
Oh, we meet that topic today. Gonna be here today. It's last turn though, so maybe we need to do it.
Yeah, let's go to
All right. I don't have anything on the table today.
There's a lot of people in the room that have presented, and I just think it's good for them to hear that we are going to be fair.
Did you say that an administrator, they wouldn't be charged for the cost of that?
Right, so
Right.
part of my job for this, which is very much part-time, but part of what I did this last year is I went through every law enforcement agency in Colorado. And I've sent emails to every chief and every sheriff. Now, they may not always get there because I don't always everybody have accurate information for every organization, so I went to the general mailbox. But I have done that effort and tried to get that information out there to everybody. But if there's a member from an organization, hey, look, I want to go through this training. A good example would be Durango. Basically have one of their officers go through the training, the training officer go through it. Z School was happy to waive the cost to get them to get an evaluation on the program. It's really about getting legitimizing training, and so they're all for doing.
So for the council, and I'm not associated with Fountain PD, I would be willing to sit down and go through the training. If it would be waived and I could give it a assessment on it.
Absolutely.
4 hours.
Yeah, give it me, and there's absolutely no problem with that, what you talked about.
Jake beginning.
Huh?
Jake beginning.
Dr. Levy actually called me about a year ago to discuss this program.
Okay,
I'm still looking on the website.
okay.
And so I just wanted to ask a couple questions for clarification for the council. So when we discussed it, my understanding is this is a course that was put together through Z Schools with UCCS. And so officers attending this would be getting UCCS credit hours towards
Yes,
furthering their college.
I don't know exactly how many that is, but you are correct. I do know that there are credit hours for certificates of completion. That's one of the reasons UCCS is monitoring the certifications.
Okay, and then for PDFs, great movers in the room, probably something you'd have to come back with, but looking at the overtime costs for your officers, whether this funding would be supplanting already planned for overtime costs, or if this would be addition to your regularly budgeted overtime, that would make a difference on if it's eligible.
It should be in addition to what is already going on.
Perfect. Thank you.
Any final questions? If you're not,
I actually do have one more, sorry, very quickly. Do you have data on folks who have gone through this program and other, even if it's in other states, about, you know, whether it's even just a self-reporting survey on how they were able to deal with opioid issues in the field? Is there anything like that that you could provide?
I believe there is. I don't personally get into that level, but I do know that they have the data sheets that were attached to the grant request. And maybe that might have some initial information. But I'm sure now that so many more programs are been established, let me find out for you from that we can get that data. Thank you. Thank you very much.
Okay, so with that, we are at the end. 5 minute break, 14, we come back. One. Now,
We're gonna really go that.
we're tight. Last seven.
Headed that way too.
Learning on my fast. Hey, guys, fine. Yeah. Yeah, and that's.
Yes, I can.
Seems like constant. Where do you want to? You're probably. These are sugars. Yeah, it's not sure. Yeah, pretty nice. What is it?
Like that catch. Yeah, I'm just gonna search it straight down.
Starts. Yes. Someone's still. It can be in circles. Starting out, she was like, started there. That had to be very much. Seeing it like. I didn't know this was actually. People. So. What's the water? Not. She knows if the Robert is farming. What it is, I'll put you out here.
It's just like the. It's not just that. I don't know. So I.
But I'm going to do this. You're going to set my. Oh, where's it already?
Students.
I agree.
Like, I'm sorry, guys.
Reconvene. Gonna reconvene.
Yeah.
All right, everybody, we're gonna get started. Thank you.
Okay, so with this, next up is the Christmas special and final award, and then we're gonna go actually to Amanda Grant financial report, and then we'll come back to this section, so. So you come into this meeting quickly. And then materials in front of you for a financial report.
Yeah, but I printed all mine out, so it's yours. Sorry. Okay, so not much to report on financials, for this last month or quarter, all we've received in is just the interest income that we're earning on our, the money that's kind of just sitting in the bank. We did receive, and all of your jurisdictions should have received some information on the Purdue settlement. Everyone has to opt into that separately. That isn't a region opt-in, that is a municipality opt-in. So make sure your folks are looking at that, and that's done by September 30th. Once that's done, then we'll see how much Colorado is getting, and then they'll allocate it down to the regions, so we'll have a better idea of that settlement. So the yellow highlight is really what you guys are probably most interested in. That's about $10.2 million that we have available for allocation right now. And then the other document you'll see is the grants agreement that my staff have prepared for the awardees that have been awarded funding so far. So this is the template that I intend to use. It's much more streamlined. It's not our giant government contract for services that we had anymore. So I intend to start sending these out next week. I just wanted you all to have a copy of it so you could look at it. If anyone has any concerns, you can reach out to me on my
Just as a reminder for the board, we have roughly 10 million available, and what is the current projected? I know you don't know the number yet for Purdue, but where are we on the total current projected revenues through what year again?
So we have a little bit over 10 in the bank. We have about 6.5 setting in the database available to pull down with another 2-year plan. So there's really about 16 available to us, right? Think about it like your bank account and IRA one's a little harder to get to. And we're projected to get somewhere between 67, 69 million through 2038, with most of it being front loaded in those first 10 years. And then those settlements will trickle in the last part.
Thank you.
Yep. Any other questions?
Motion to accept.
I'm just a quick. You said 69 over the 18 years. I know Laura was asking
Somewhere around there, yeah.
So if we were to equally distribute that over 18 years, that would be approximately $3.8 million a year.
Yes.
We're gonna get to see it front loaded. So that's for us to realize if we spend everything in the bank account and I'm not being money, that's the end of this.
That is correct. And then also keeping in mind that we have to reserve some of that for facilitation services and things like that. Yep. I don't need a motion to approve my report. It's something that the chair had already given us permission to staff. I just wanted y'all to.
So we have two orders of business. First, we need to advance as we know, we advance for further consideration. These two applicants, for trades. So the two orders of business are we advanced last month. And now we need to vote for them for final funding. And then we also need to advance today's participants that we agreed to for further consideration of that. Yeah.
That's what. Signs for her. She sees it all the room. She sees it right on. You go to jail. It
Tech skills to facilitate. So I'm gonna list the ones that we have shared for last month. So these are the July ones. So we have an opportunity to advance the ones that we are ready to advance. And then these are the June applicants that we advance for further consideration. So if we're open to it, I'd like to first start with the June applicants that we advance for further consideration. To see if there's anything we want to discuss on any of them individually, or we'd like to vote them.
I just have a question, because you're saying for further consideration. This would be the final vote to fund these costs.
Yes, as the agenda item says, this was they weren't paying for further consideration, so now it's a final vote. Those are the amounts, and that is the.
Did you have one that was highlighted? Because I don't remember that.
Right. This is.
Oh.
These will all, yeah, for consideration.
Can you show the amount that was originally in the buckets that we allocated?
So there will not necessarily an amount per bucket. Let me say the question a different way.
Originally, we did put aside certain amounts into certain buckets. Now we can move those around, but we did initially as a council do that. So that's what I was looking at, is what those numbers were. So you have that, but you give me a minute, I can look at it. That'd be great, thank you.
And James, I did have one question there, and I hit you with it earlier today, and I don't have it in, I didn't bring my notes.
It was Serenity.
From Lila's Serenity. My only request with Serenity is, should this council vote to approve it, is that I would like to see, I can't remember the name of the Latin term for X amount of dollars for administration of this grant, is that I want 100% of the funds to provide to go to services, not to administration. So I would like to see that stripped out of it, should this council vote to approve that. It was like a 10 or 15% administration fee.
While we're pulling that, give a moment, let's go back to this month's applicants. Is there anyone on this list that we are ready to advance or to speed things up or out too much further discussing?
Well, it's not gonna be so simple as to advance. I actually wanted to suggest on one of them, which was NME Recovery Residence LLC. They were serving currently age maybe up to 12, they'll make a new men's one. The cost of is $700 per month. To do the math on if they actually had 20 people per month, servicing at $700 a month for an entire year, that's $168,000, which is just about the exact amount of their entire request. My suggestion is, and to their statement, that getting people over that hump at the early part of the program was important. And that I would be much more comfortable with funding that number of about 20 people, assuming the men's one gets off the ground for up to 90 days, which would be the first 3 months, which would be $42,000, not 167. I would be more comfortable with help providing them grants to get people started into it. If the goal is to get people self-sustaining so that they're sharing in that cost, the numbers don't add up to me for the 12 months because that would be paying for everybody for the entire year. So my recommendation on that one, should this council want to fund them, and I'm not suggesting that they do, but if we do, I would suggest that we fund it more to the level of about $42,000.
For consistency, again, I just want to make sure if they're on process, you said make a motion, the way that we've done these has been a thumbs up to move these forward, right?
Yeah, the motion is for the final vote. This is just kind of
But the
wondering.
ones that are on the screen are not up for final vote today, because it went back.
These are the ones that went back just for the purpose of time to your question side. We are now talking about the ones that just presented, and we're seeing these conversations are ones that we can advance without too much discussion. Really,
Sorry, then I would withdraw my comments because that's discussion.
I would like to advance the Light of Hill Institute. I personally have gone through the certification and have found it be pretty valuable. And the best part about it is it really reaches the community at large. And so you get a really broad range of people, an opportunity to really engage with it. And I think it's a really good tool. And it's getting better. Every year it's getting better. And this new modular, I'm anxious to take it. So.
I actually disagree. I think it's too Colorado Springs centric. I don't think it covers rural.
Well, they are doing it statewide. And it is on El Paso County's website, the Rise. Yeah, Rise.
So, I'm sorry, I can't remember, but it's on the health department to promote this
Yeah.
regionally.
Yeah, it is on your web, it's on the El Paso County's website, right?
That's what I asked. They said, well, they plan to read or have a goal to reach out to the other agencies, so. Okay.
Yeah, I'm gonna have to respectfully agree. I characterize it, and I don't mean to be negative, but a self-help app, it doesn't seem close enough related to what we are trying to accomplish with opioids. I understand that you're very passionate about the subject, and it may be a very good tool more broadly. But I think for the purposes of this funding, I really struggle to see a firm connection, especially when we are hearing from a lot of organizations who are helping people in person. They do actually, like, for example, Full Circle or other folks who bring in the families. And that hands-on training to me is much more valuable. And I'd rather see us fund programs like that than kind of a static app that is not interacting with folks.
Other thoughts? That conversation or any others? Okay, so we're gonna pivot back, and let me just say that part of what's happening here is it was a lot easier earlier on in the months because those were higher rated scores. So we were having quickly pushing through some and saying, yes, we agree without discussion. These scores were kind of lower actually. And now we're having a broader discussion. So it's harder to do what we've done in the past. We're fighting to go through one by one. Just having the full conversations. So let's pivot back to month of June. And these are the ones that were advanced for further consideration. And now Amanda has a question, an answer to your question.
So in the original plans where you guys had went through and allocated money, there was just over 3 million in youth prevention, 1.2 in community prevention and education awareness, 600,000 in that, 2.4 million in recovery sports and transition, and then $6 million in the family advocate bucket. We have since updated the cost portal just to pull that additional funding down, and so we allocated into the buckets in the same way, just the same percentages, just additional money to pull that down. So there is more in those buckets available today.
Yeah, can you tell us what it is today?
Yeah.
And then in the future, I would request that we have the facilitator include all that information on the slide so that we can see it all at a glance.
So specific to MAP treatment,
Can we just do the recovery supports and transitions for clarity at the moment?
5.5 million. That's like that.
Which Matt, you were starting to say, Mac,
Sorry, speaking of that, that was just under 800,000, yeah.
So Chair, I'm super confused. Are we back here or are we moving the ones we just heard forward? Like, where are we?
So we started at the June discussion, which is this discussion, those have been advanced. There was a question, so we went to July, now we're back to June. So this would require a full vote and we're on agenda item 4, which is the final award of funding for the June applicants. So now's an opportunity to look at these and say, after talking about them and interviewing them last month, to say whether or not there is one that you still have further questions on, or you'd like to pull from this group. The hope is that we can vote for these as a group and move them forward for final funding.
Okay, so you're asking
Contract,
for a bucket because,
correct.
I mean, I have individuals, yes.
Yeah, I was gonna suggest, can we not just vote on each of them individually as opposed to a
We
bucket?
can definitely,
I think that would be an easy way to do that.
let's do that.
Well, I absolutely will support moving Homework Pikes Peak at the full amount forward.
So why don't we, you had your finger up.
I would say, is that a motion? And it's a-
Yeah, okay, that's what I was gonna say. So,
So moved.
you're moving to advance, Homewood Pikes Peak for funding.
No second.
Second, any discussion?
Can I just, because you're saying advance them to funding, so you mean final approval?
Final approval.
Okay, I just want to make sure I'm clear. Okay, got it.
All these are up for final approval of funding. Okay, so any discussion on the motion? All right, all those in favor of giving final funding to Homewood Pikes Peak, aye? Aye. Anyone opposed, say nay.
So I want to face it together. Is there a motion for that?
Can I ask another question before we go? So the buck is 5.5 and then we're approving, or we just approved 581. 340, is that correct? Okay, so I just want to keep up with the bucket. Thank you.
Is there any motion on face it together?
5 seconds to put in my notes.
And then,
Yeah,
Hi.
good.
So you want to put together, I don't mean to interrupt, but
You can stand up, just, we've got the all here.
yeah, I don't mean to interrupt the process, but for clarity and transparency, you have the wrong amount listed for us up there. Our original application was for the 240, but because we were 6 months off cycle, we were asked to put an amended request before you guys. So that's what I presented last month with 88,000. And then we submitted a new application for the July deadline for fiscal year 2026 or calendar year 2026.
So it should say 88,000.
It should to line up with what I presented. I mean, I'll take 240,000, but that's not what I presented last month. So just to align with meeting minutes and presentation.
Thank you for doing that.
I remember that at once.
Yeah.
I remember that's correct.
If that's not what we were supposed, that's what we were told to do because we were 6 months off the last previous cycle. We had to stretch 12 months of funding into 18 months.
Yeah.
We were asked to ask for 88,000 to cover the end of 2025, and then you'll see a new application that we just submitted for 2026.
Thank you.
Thank you. We cross-referenced it to the original application, so thanks.
Okay, yeah.
And so the actual amount then is it?
88,000, something.
I can,
Thank you. Yeah, it was on my slides and our amended requests.
You can.
I did, and yeah.
Okay, while James is looking for the
88,500.
88,500 unit, second,
Yeah, I saw.
88,500.
Yeah.
We have a motion from Terry to advance Space It Together. We have a second from Eric. Discussion on the motion to fund Space It Together. Yeah, go ahead.
Nope.
Oh, I thought you were like a bid. You raised your hand. Then.
Wait, why would that?
Bought it for 88,000. All in favor of the motion to advance Space It Together at 88,500 or 80,000? What is it, James? I'm sorry. 88,500. Say aye. Anyone opposed?
Great. Thank you for that. Is there a motion for another one?
Motion for another one? Is that what you just said?
Yes, we can go chronologically, or we can make a,
Are you talking about the next one on the list?
so let's part. Hazelbrook.
Hazelbrook Community Center?
I think I'd like to pull out Serenity Recovery Connection.
Let's just go,
We're at Hazelbrook.
yeah,
All right,
we'll get there.
okay.
Anybody want to make your motion on Hazelbrook or further discussion?
Is that Hazelbrook Community Center, does it not have a dollar amount?
It's running across, that's at 183, 185, so it's Hazelbrook.
Is that not Paradigm One? They are, that's their DBA. Oh, I see, okay. Okay, yeah, that's it.
See, okay, here's the back there.
So I just wanted to bring up that I did some research and asking around folks in the community because they do operate in other locations. And I discovered a lot of concern about their operations and lack of transparency with funding. So I have some concerns about this one.
Do you want to share the concerns?
Yeah, just a lack of financial transparency with the founder and concerns about the actual programming and particularly up north where they are operating from other community members and folks that work in this space.
So can you give more detail or?
Yeah, I mean, but they just have the lack of transparency and funding, and that the funding numbers have not added up there. And that the numbers of people who are being served in the efficacy rate, I guess I would say, or the success rate has been low. And again, that's from folks who work in the community and other elected officials. So, I mean, could get into more details as, you know, appropriate, but that was just general feedback of asking, hey, how is this going for your community?
I don't think we have anybody here from them. Correct.
So, yeah, do I get come back to this one? Sure. Or,
Yep.
okay, let's keep going. So, wasn't formal vote.
There's not even a motion here, that one.
So, Hope COS.
Yeah, this one I would make motion to fund OCLS for the $197.14.
There's a second.
I'll second.
Dick seconds. Any discussion on the motion to fund Hope COS like the amount listed? All in favor, say aye.
Aye.
All, anyone opposed, say nay. All right.
And then Serenity Recovery.
Here's your chance, Holly.
I'll move to fund Serenity Recovery Connection. That's $469,736 and 12 cents, not a penny more.
And then I just want to note too, I know that those who have a conflict of staying, so make sure that the motion is an abstention at that time.
Yep. I would like to, if you'd accept a friendly amendment, that's the one where they have the administrative fee built into it, that I would be in favor of supporting them if we took that administrative fee out of the grant. I don't remember how much it was exactly, but I think we could, if you'd accept a friendly amendment.
99% of the time I will, so yes, I will.
So the motion,
And then I would say,
the motion then is to fund Serenity Recovery at that amount, but taking away the administrative fee that was built into their proposal.
Yes.
Okay, and you're second.
I am seconding that.
Any discussion on that motion?
Can we find out what that number actually is, just for clear? Six.
We have Sherry Trainer right here in the audience. Thank you.
$61,289.93. 269.93, sorry. $269.93.
Go ahead, Eric.
Was that classified as an administrative cost or is that an indirect, right?
Indirect cost.
So just in full transparency for the board, there are several applications that include an indirect cost rate.
I noticed there were some today that I'll talk about in the future. Were there any I don't remember seeing them on any of these.
Well, I'll look that up. I did.
This is the only one I recall seeing on these. I know there were ones today.
Over transparency, I'm pretty sure we had a tiny bit of admin to cover my cost of accounting, insurance for my properties. I can't do building work if I don't have general liability insurance. You know, it's not to send me to Tahiti on a vacation, I promise.
Only if you take me.
Yeah.
We have a motion on the floor, Saran.
Sure, just real quick, my staff had some concern, I wasn't here last time, but my staff had concern that they have peer support and they have an option to bill Medicaid. And Serenity just doesn't do it because it's a pain.
That's not true. We don't do it not because it's a pain.
But you don't do it.
We don't do it, but for a reason.
But I've heard testimony today or presentation that other vendors here do bill Medicaid.
That's correct.
You care to share that with me?
Yes, for peer support and the change of Medicaid funding, it costs us more to bill Medicaid than we get reimbursed. Because for purely peer support services, we don't have the other add-on services that other organizations do bill for. We're just purely peer support, and it costs us more than it does to pay for staff.
So it's a, okay, financial.
It's a financial.
Okay, thank you.
Welcome.
Right, Jerry.
Can I just make a request in the future, because of this exact thing, with trying to identify? I think we need to get to a process where, at least on these, and I kind of drew myself a picture earlier that would be helpful for me, but I can't find it right this second. But basically, if we have Homeward Pikes Peak, Face It Together, you know, can we get a chart of like, here's what they offer, peer support, or here's what they're asking for money for? And if it includes peer support, if it includes housing, if it includes other things in kind of a checkbox form, if you will, because if, for example, if we have 12 applications of people who are providing peer support, and we have some who are able to bill Medicaid and would be more sustainable, that would be a useful piece of information for me to evaluate. Do we need to fund all of these peer support programs? Are there ones that are more successful than others? And that's not, I'm fine with moving forward today, but it's just something that I started thinking about, and it kind of reminds me of why that would be valuable, is to kind of see all those different pieces in a snapshot.
I probably need to have a conversation with you, but willing to support those efforts. So there's a motion on the floor. There was an amendment?
Yeah.
So the amendment is to fund it at basically 460 something thousand. Probably that's $60,000.
That amount less $61,269.93.
And I support the friendly amendment. So.
So we have a discussion of that.
I'm satisfied.
You're satisfied? Any other discussion on that? Okay, let's go to a vote then. So all in favor of funding Serenity Recovery Connection, say aye.
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 Any opposed?
Next is the City of Colorado Springs. So this was going to it for the TAP program. If you remember TAP that we talked about extensively last month. So this one was for 300,000.
And I know we'll have some discussion on it, but I will make a motion to fund the City of Colorado Springs too. And so I will make the motion, and like I said, I know we'll have some discussion on it, but I do think it's a good program, and I do think they're providing a diversion in a way that nonprofits and others cannot or are not.
And just for record, you're gonna do you want to say something?
No, I want to recuse myself.
Yeah, that's what I was gonna say. Recuse. You're gonna recuse.
So council,
So what about council?
Well, you're not part of it. We haven't
Okay.
typically done that in the past.
Okay. It
Yeah,
says City of Colorado Springs.
Yeah, it was really Colorado Springs Fire.
Okay, so we're fine.
Mr. Chair. Yes.
I'm sorry to interject. I think in the past, there's been an extension from voting as opposed to a recusal. Recusal sort of carries legal connotations and there might be another one.
She's abstaining from voting then?
Yeah.
Yeah.
I think the question was asked earlier, if he was going to recuse himself, and I think that's why that language came in on the last one. That's. Yeah, I get it. Let's get the language right.
Lynette, did you have other comment?
No, that was, line where we was just saying,
We were talking earlier.
Okay.
since we're doing the budget and we're knee deep in all of that, should we recluse ourselves as well, just for transparency? That's what it was just, we were just talking about.
Yeah.
Abstain, I'm sorry.
Sorry, Kenny.
I don't feel like that's an issue, Kenny. Do you feel like that's an issue for council members? So we have a motion to fund Colorado Springs Fire Department. We have a second.
I'll second.
Any discussion on the proposal to fund Colorado Springs Fire Department?
Yeah, this is one I had real concerns with previously. I disagree that this is a good use of funds. Some of the things, you know, sending folks and sitting around municipal court and some of the other things, I just don't know that it's the best use of our funds for that particular thing. And I'm also concerned about growth of government and long-term sustainability with some of the programs that are coming forward. So I will be opposed.
Okay, another discussion?
I actually really supported this one last month. I have concerns this month because you know, I know that the city is in a bad situation, but after the whole discussion over the marijuana ballot initiative, I think there's some, I'm just worried about the city's reaching for everything they can grab, not forgetting, you know, I love our two council members here, so don't take it personally. But you're out there reaching for everything you can grab to make sure that you make your budget make ends meet this year. And I question that because I'm worried now that it won't be used for the right purpose. And I totally trust, you know, Judge Kane and our fire department. I've worked with, well, unfortunately, I've been in front of Judge Kane before for traffic tickets.
You don't have to.
Excuse myself, can I comment? Only twice? Come on, in 30 years, only twice. And so I'm worried about it this month. So I'll probably be,
So I'll,
unless you can.
I'll just make a comment on, in that, we put forth an ordinance on the marijuana tax just because of that issue. And so.
Because of the budget issue.
Because of the budget issue, right? And we, city council, will be putting forth recommendations on how the marijuana tax is gonna be spent. That's what we're gonna be doing now. And so thanks to Lynette's leadership, did that feel good?
Thank you.
Anyway, so we have addressed, we're doing everything we can to address that particular issue. And we would follow up to do the same thing with us. So.
Meaning safeguard the funds, is that what you're suggesting? So that it's not being used for other things to cover city budget shortfall or something like that?
And I guess my question is that if you were to get it in the future, would you lay out to 2 employees if you couldn't find the money?
That would happen.
Because, you know, El Paso County went through massive layoffs from 2008 to 2011.
That's the reality.
Just to get things done.
That's the reality.
So my only question with that was, and because there was no clarity, because I wasn't able to talk to just the presenters, there was a lot of interjections. I couldn't get the direct line from the program, which I think is a great program because you're catching people from court who are camping. Direct related to opioid crisis, because the people that are going to court are going to court, whoever shows up because they get a ticket for camping, illegally camping, and then they go to court because they got a ticket for illegally camping. That's, I just couldn't get out the direct line to the opioid dollars to be judicially responsible with the opioid dollars because of so much interjection and so much back and forth. The two pleasant people presenting never got to answer that question for me, or I don't know how other many people were in the room during that, but it got very convoluted. So that's my problem, is I know I didn't see a direct relation to opioid funding versus illegal camping. Because you could have this weekend got an illegal camping ticket. And I think you're eating fish. So that was just, I never got that direct correlation to opioid dollars. That was never clear to me.
I think their hope was when they ended up in jail for one night, for whatever, that they would catch them on the way out, and instead of going left where they could get a lot of drugs, they would turn right where they could get more services or something like that. I don't know. But you're right, there never was a direct connection.
We've got Dr. Brodsky back. Why don't I come up here, but don't start Pikes yet, but come up here. Carrie had her hand up, so let's give Carrie a chance. But come up here so that you can answer the concerns.
Yeah, I will be frank and say I echo the concerns that Commissioner Williams shared. And I'm going to also be frank and say I personally had a conversation with Mayor Yemi, and he specifically said to me, we need all the dollars we can get. And that was a very concerning statement to me, particularly in regards to this. And it did absolutely seem connected to the budget issues. And with all due respect, as you know, once you guys budget those items, the mayor makes those decisions. And so I do have great concerns about the intentions, and that, you know, quite frankly, the budget has been mismanaged by the mayor. And as a result, I think that, you know, looking for additional funding for all kinds of things and grabbing out of that is very problematic to me, and it's a growth of government. And so I stand by my original comments, and I wanted to put that on the record that the mayor specifically made those comments to me.
I think I can answer a couple of the questions, and just because I'm affiliated with on the periphery with how these programs are developed at the Colorado Springs Fire Department. So as far as making the connection to the opioids, that is something that I think this committee has needed to understand, that they're not necessarily, some of the programs that are out there are like a direct connection, right? Like the Colorado Springs Fire Department runs a MOUD of MAC. Okay, we're only going out there, we're treating people right actively that are using opioids. There's no question about how that relates. But the vast majority of the programs that are really developed out here and presented out here are it's all intertwined. Okay, we're talking about the populations who are using, and sometimes there isn't the, oh, I'm catching this person because they used fentanyl last night. When we talk about housing, or we talk about peer support programs, or we talk about anything, a lot of these programs are in that population, and everything is linked together. And so I don't think that this program has any less of a link to opioids than the majority of programs that have been presented to this committee since its inception. And so I'll just throw that out there, if that makes sense. Does that answer some of your questions? No?
But actually, it actually doesn't. Because if I remember the presentation, it was, they're gonna catch them at court because they were illegally camping. And they were gonna help them get a house with a voucher that we have fewer and fewer of. And so, thank you for that, but that was not in the presentation. And I understand what you're saying, and I appreciate that clarity, but it should be in the presentation.
Okay, well, obviously that wasn't in those words.
Right, it is
So
connected. And are we assuming everybody camping is doing opioids?
No, but we can't assume that everybody who is getting any of the services in a lot of these programs are directly with opioids. Okay, so.
Every one of them that we heard today was.
Okay, so maybe I'm misunderstanding what you're saying. What I'm saying is that if and I'm just using an example, okay, if we have an organization that's coming out and talking about providing halfway house, services, okay, are we going and are we saying, oh, each one of those is only going to be provided for the people who have been using fentanyl? Or are they in that group of people who are out there in recovery based on substances that all cross over and everything, and therefore providing those services is touching that same population? Okay, so the whole idea of this particular program going to the courts and catching people there isn't because they're trying to target people who are illegally camping. Okay, they're using that as an entry point that they know nobody else is doing. Okay, so it was mentioned here earlier today, what may be a yes today will be a no tomorrow. Okay, and the idea of trying to catch this population who can benefit from this services in any way that we can and they were using that as an example. I don't think that they were saying that, and I can't speak for the people who presented, but I don't think that they were saying that that's the entirety of the program, that they sit there and just catch people who are illegally camping. I think it was used as an example of how they're using that as a catch net for this population in a way that is not being utilized anywhere else in the city.
Well, then maybe we should have the presentation again, because that is not how I recall the conversation. I would just like to say, I am getting concerned about what has now become 2 meetings of back and forth over this one particular issue and the unfairness. I think that we need to be setting timelines for everyone to give their presentations, and I get that we all have extra questions, but I think it's unfair to the rest of the applicants when we have allowed a lot of this to go on and on. So that's personal opinion. The second thing is, you all have different opinions on this. Each member, that's our job, is to interpret whether or not we think that there is a good enough nexus, and if that's the priority for the spending on this council. So I would respectfully call the question and just let's vote. Let's do it.
And so just FDA staff is kind of at 5 o'clock too.
So we were in discussion,
Oh, it's fine.
we didn't ask to call the question, so let's go ahead and do that. So we have a motion to approve this funding. We have a second from Sheriff Lloyd. All in favor, say aye. Aye. Any opposed?
It's to approve the funding, right? So
To
I
approve the
vote
funding.
no.
So we have 2 no's. Are you,
I don't know,
Okay,
because
three
they have clarity.
so we have 3 no's and there are 4 no's.
4 no's. So let's
Go ahead and count.
Yeah, so we,
Do a hand count to be.
all in favor, raise your hand.
So counting 6 and 4.
It's a majority.
Okay, so that has approved. The last one today, we can take a motion on community partnership family resource center.
I would move to approve Community Partnership Family Resource Center in the amount of $167,000.
Second.
Who's second? Chief Tyler.
Any
discussion?
Vote then. All in favor of the motion to fund the Community Partnership Family Resource Center? Aye. Any opposed?
So for the July applicants who are presented today, we're gonna have further discussion about your application. It has been advanced to this stage. We're gonna have continued discussion in our next meeting. In our next meeting as well, we have August applicants to discuss.
Are you going to go back to Hazelmark to get a definitive vote for this?
So.
That was when we discussed and they didn't vote on it and went back.
We didn't have a motion.
Yeah.
Yeah.
It never came to a motion to.
Okay.
If somebody wants to make a motion, we can.
Do we need a motion, or can we just do motions to approve?
Why that motion to approve, but why?
Right.
I don't just do motions to approve it, right? There's no motion supporting the application.
What I would suggest is that, we give them a chance to potentially answer the questions.
Sure.
That have been raised today. So if we can reach out to them and maybe have them come to future meetings. I think that'd be the fair way to do it.
I agree.
And I think there's other applicants in that same bucket, so it's not a no for them yet, it's still, they haven't been awarded, the other ones have been awarded, that those discussions will continue. I think we're going to,
So maybe we wait till the end of filling the bucket and then have anybody we want to come back from that?
so next month, August, we have other applicants in the schedule, we'll also just be September, for the ones that, they still need stuff like that.
And do we still have some off of today's list though, that we haven't yet made any motion on, or we get all those done?
Where, the way it seems.
We're gonna need to add those to the next
Yeah,
agenda.
because we're gonna need more conversation, it wasn't one that was clearly ready to be advanced.
So we might need to review our August schedule to fit all that on,
That's
so
true.
I'll let you work with it.
Yeah, we were going to see, there are only 7 next month, only there were 9 today, and we went a little longer than in some of these sections, and I can do a better job of cutting, some of that as well, it's hard. Yeah, there's more money, right?
Can I ask on the, I know we have to adjourn, on the youth pass one, is there a way that you can reduce that amount? Because I felt like it didn't fit into the buckets at all.
So that will be discussed.
Okay.
So, to adjourn.
So you're not coming back next, not taking one?
No, I'm not, but Lauren was here for me, so we're okay. I just felt that it should be reduced.
We haven't done.
Like that's.